Just a second. Let me confirm. I will start the class in few seconds. So I guess it's working. Yes, I guess it's working. So I welcome you all for today's session. A very good evening to all of you. I am Dr. Priyanka Sachdeva here, and today we all are gathered here to take a session exclusively for second Prof University exam students, and this session is of pathology. So here you can see we are going to take very important topic of pathology in the form of the long answer writing, short answer writing, very short answer writing. This is the session for the fundamental batch for the second Prof students. Okay, so all those students who belong to second Prof and who are going to write their university exam in the next few months, this session is going to be beneficial, highly beneficial for them. So let me start without wasting any further time. Let me start. So can I start? Let's start it. So here you can see we are taking a session on pathology. So we all know in the pathology we are having three sections, that is general pathology, hematology and systemic pathology. In the general pathology we are having these 9 units, chapters, whatever you say, to cover. So today we are taking one of the important unit, hemodynamics. In the hemodynamics I will teach you very important topics today. For sure, you are going to get one of the long question on the topics which I am teaching you today, because it's a very important, ultra important topic, and very frequently you get questions. Almost every year you get questions in your university exam from this topic. So I will teach you 3 topics today. Let me come on that. So these are the topics of general pathology. I guess everyone knows in general pathology you are having 9 chapters or 9 units, right? In the hematology you are having 4 chapters or 4 units, and in the systemic pathology you all have 12. So 12 plus 4 plus 9, this is your syllabus. So syllabus of pathology is very small. Yes or no? What do you say? So this is the syllabus of your university exam, and in this batch we are going to cover all these topics of the general as well as hemat as well as systemic pathology one by one in detail, and in the form how to write your answer, how to frame your answer, how to write your answer in your university exam, so that you can grab a distinction or gold medal in your university exam, right? So this session belongs to the students who are going to write their second Prof university exam this year. So as I told you, in the general pathology I am going to teach you a topic from hemodynamics. So in hemodynamics we have all these topics to be covered. Okay, so today we are having 2-hour session. Okay, so in these 2 hours I select the most important 3 topics from which short you will get a question in your university exam. I can claim that, I can challenge that. The 3 topics, ultra important topics I am going to cover here is shock, thrombosis and embolism. Okay, and I will teach you in a very unique way these 3 topics. I will teach you how to write your answer in your university exam. I will give you the points, the overviews, the headings, the subheadings, and I will tell you how to frame your answer in your university exam. So you know that topics are same for the preparation of the university exam as well as for competitive exam. Now the point is that you study pathology for 2 purposes. Pathology for passing your university exam and to get a distinction or gold medal, or pathology because you get questions in your competitive exam, whether it is NEET, PG, FMG, INICT, USMLE, PLAB, whatever you say, one of the competitive exam. So the purpose of studying any of the 19 subjects is to pass university exam and to solve all the MCQs. But the approach is different now. So whatever topic you teach here, whatever topic you study here, you have to understand that topic by both ways. If you're preparing for university exam, it should be crystal clear in your mind that under what headings. Now if shock is coming for 20 marks in your exam, how to frame it? It is a long question. If it is coming for 10 marks, how to frame it? If it is coming for 5 mark or 3 mark or 2 mark or 1 mark, how to frame it? In many universities, I'm talking about India, you know, there is a pattern in which you get 14 or 16 MCQs also. But these are the simple MCQs. So how to go for that topic? So approach is very important. Approach is very important. Okay. So, you know, I have seen that in university exam, most of the students, where they are lacking, they don't know how to write their answer. They have the concept within them, but they don't know how to frame it and how to write it and how to present it. So here we will solve this problem also. Along with giving the concept, along with explaining the topic, we will give you the headings under which you have to frame your answer. So that is, you know, the concept is not changing, whether it is MCQ or whether it is a subjective exam, but you know, your how to present it, it will change. So we will study 3 topics today, ultra important 3 topics, that is shock, thrombosis and embolism. Can I start? Everyone give me a thumbs up. Can I start? So one by one we will solve the topics, the 3 topics we will study. So let's start with the first topic, shock. Okay, now shock, if it is coming in your exam for a long answer, so these are the questions in your university exam which we picked from last 5 years from entire universities of the India. We have seen what topics are asked from this topic, what questions are framed from this topic. So these are the long questions you can see, these are the short questions you can see, these are the very short questions. I will read this list, let me explain the topic completely, then in the end I will show you this list and you can solve any question, any of this question coming in your exam, whether long, short or very short, you can easily write it. So let me explain you. Okay, now if shock is coming in your exam for a long question, you have to write this under these headings. So my point is, first understand the overview. So as soon as the question paper coming in your hand and you see the shock is asked as a long question, so in your mind, before you start writing in your copy, it should be crystal clear under what headings I'm going to write. It is not just start writing in paragraphs, whatever is clicking in your mind, haphazardly. No. You will pass, you will barely pass, I can say, but you will not get distinction or gold in that case. But if your copy is neat, clean, concise, under headings, under subheadings, and you are giving the actual concept, all the important things you are underlining, definitely you are going to get distinction. It's very easy to grab a distinction in university, let me tell you. Okay, so listen now, listen. So if shock is coming as a long question in your university exam, so you have to frame your answer under following headings. First, write down the definition of shock. What is shock? Explain it. First, write definition or introduce shock. What you understand from the term shock, number one. Number two, then you have to write the classification of the shock. How many types of shocks are important in your syllabus? There are 3 important types of shock. Hypovolemic shock, cardiogenic shock, septic shock. Each of these shock, you have to write the introduction of each of them, the causes of each of them, pathogenesis and symptoms of each of them. In the end, we will make a comparative table between the 3 under these headings. Okay. And in the end, overall, you have to write down the morphological features of all type of shock. So these are the headings. If it is coming as a long question, 10 marks, 20 marks, different universities have different pattern. Long question means you have to write down at least 4 to 5 pages on that. That is the meaning of the long. Whether it is 10 mark, 20 mark, doesn't matter. Okay. So that is the meaning of the long. But sometimes you get a short question on one of the shock, either hypovolemic or cardiogenic or septic. So you get a short or very short question. So in that case, you have to write down that portion along with the definition of shock. That's it. You don't have to write down others. So you should understand the approach first. So can I start shock? Can I start? So let's start it. So what is shock? Let me first explain you what you mean by shock. Shock ka matlab kya hota hai? What do you mean by shock? So you know, in entire body, in our human body, we all have a heart. The heart is pumping. Whenever the heart is doing systole, the ventricles are doing systole, the blood is ejected via aorta. The pure blood, oxygenated blood, and is supplied throughout the body. That is known as tissue perfusion. From head to toe, human body is made up of multiple organs, multiple tissue. But each and every organ of human body gets blood. It gets perfusion. Why the blood is important, you can see here. So you can see this is the heart. When the heart is doing pumping, when the heart is doing systole, when the left ventricle is doing systole, the oxygenated blood is coming and distributing entire body, supplying each and every organ from head to toe. This is known as perfusion. So all the organs have blood perfusion. Why? Why each and every organ requires blood? Because of the gaseous exchange. So whenever the blood is going in each and every organ, the oxygen in the oxygenated blood, pure blood, is given to that organ and carbon dioxide is taken. So for gaseous exchange, you can see the gaseous exchange taking place. See what is oxygen and see what is carbon dioxide in this video. You can see oxygen is coming into the tissue and carbon dioxide is coming into the blood. So the oxygenated blood convert into deoxygenated blood and revert back to the right side of the heart for purification again. So we know the cardiac cycle. Okay, tissue perfusion is important for entire body. Now imagine if there is no or less tissue perfusion due to any reason, if the perfusion is less. If the perfusion, by perfusion I mean the blood supply. So blood supply of all organs together simultaneously is less. I will tell you the reason. That is known as shock. So the definition of the shock is reduced tissue perfusion in entire body. What is the reason? In 3 different type of shock, the reason is different. So, but the pathogenesis is different, but the meaning is same. Ultimate thing is that decreased tissue perfusion of all the organs together, multiple organs together from head to toe. So all the organs receive less blood. Okay. So reduced tissue perfusion of multiple organ. So body is not getting enough oxygen. So all the organs are not getting enough oxygen. So in all the organs, there is anoxia. Anoxia is lack of oxygen. Anoxia or hypoxia, whatever you say. Hypoxia or anoxia is lack of oxygen. Because of lack of oxygen, the cells of that organ will die. So multiple cells will die. cells of particular organ, the cells of liver, the cells of spleen, the cells of heart, the cells of kidney, the cells of intestine, the cells of multiple organ will die. First the cells will die, then the tissue will die, then the entire organ will die. I mean entire organ will fail. So in shock, multiple organ fail together. So shock is a syndrome, it's not a disease. So say the complete pathogenesis, what is happening in all the shock? So whether I say it's hypovolemic shock, or I say it's septic shock, or I say it's cardiogenic shock, ultimately one thing is common in all of them, there is reduced tissue perfusion. So all the organs together are getting less blood. The reason is different. I will tell you the reason also. Okay. So due to the reduced tissue perfusion, the organs are not getting enough oxygen. Okay. So there is cell death, which leads to organ death. So multiple organ failure, whole body failure, and that leads to death. So shock is a syndrome. First, write down the definition of shock. So this is the definition of the shock. I hope you got it. So Anshika, have you got it? The meaning of the tissue perfusion. The perfusion means blood supply to the organ. When the heart is doing the systole, the left ventricle is ejecting the blood, the pure blood, and the pure blood is supplied to all the organs. That is known as tissue perfusion. Okay. And that is necessary. If multiple organs are receiving less tissue perfusion, then the first of all, the cells of that organ will die. Then the tissue will die, then the complete organ will fail. And when multiple organ will fail, the person will die. So this is shock. Give me a thumbs up if you got it. How many of you got it? Can we go ahead? So this is the definition. I hope you got the definition. Now coming on the classification, how many type of shocks are there? There are 3 type of shocks: the hypovolemic shock, cardiogenic shock, and septic shock. We will study the 3 shocks under these heading. I will tell you the causes of each of them, pathogenesis of each of them, and symptoms of each of them in detail, and we will fill this table together. So I request the students to take out your notebook, to take out your pen, and fill this table simultaneously while watching this lecture. So you will not devote any extra time. While watching the lecture only, you can make this table, and in the end you can revise it very quickly. So let's start with the first shock, the hypovolemic shock. So what are the causes? Now you tell me, in human body, how much blood is present in one human body? How much fluid is present? So we all know in an adult human body, 5 liters. Standard 5 liters of blood or fluid is present in all of us. Okay. So 5 liters is the standard fluid or blood present in all adult human body. Imagine a person who got a road traffic accident, unfortunately. Or imagine a person who is having a surgery. In the surgery, there is tremendous blood loss. Or imagine a person who is having diarrhea. Imagine a person who is having vomiting. In diarrhea and vomiting, the fluid is lost, either in the diarrhea or in the vomiting. Or imagine the person is taking excessive diuretics. So in excessive diuretics, excessive urination is there. So in all these conditions, the fluid is lost. So that person, instead of 5 liters of fluid, that person have less than 5 liters of fluid. And this is known as hypo means less. Volumic means volume. The volume of the fluid is less. Hypovolemic shock. Now in my body, there is 5 liters of fluid. So whenever my left ventricle is pumping, so the blood is coming out. So there is a fixed proportion that out of that, how much kidney will receive, how much spleen will receive, how much intestine will receive, how much brain will receive. So all the organs are receiving their respective proportion of the blood, and they are very happy in that. They are doing their metabolism, they are doing their work function normally. But imagine in a human body, if less than 5 liters of fluid is present. The reason can be anything. It can be accidental loss, it can be loss in the surgery, loss by diarrhea, vomiting, diuretics. If there is a loss by any of the case, so less than 5 liters of blood is present in human body. In that case, all the organs will receive less blood, because blood is less. Whenever 5 liters is present, complete 5 liters, all of them are getting normal blood. But whenever less than 5 liters, maybe 2 liters, 3 liters, 2.5 liters, 1 liter, it depending on the severity of the shock. So that 1 liter, imagine someone is having only 2 liters of the fluid, rest of the fluid is lost. It's severe hemorrhagic shock. Okay. Now out of the 2 liters, so all the organs will receive less blood in that particular proportion only. That is known as hypovolemic shock. So all the organ will have less blood because blood is less. So that is the meaning of hypovolemic shock. Okay, hypovolemic shock is the most common shock among the 3. Among these 3, most common shock is hypovolemic only. Okay, so what are the causes? You tell me. It is due to decreased blood volume. It is less than 5 liters. What are the causes? Maybe hemorrhage in accident, in surgery, in diarrhea, in vomiting, in burns, there is evaporation of the fluid, excessive diuretics, in pancreatitis also the fluid is lost. So in all these conditions, the blood or the fluid in the body is less than 5 liters. Say yes. So what will happen? You tell me. Because of all these reasons, what are the reasons? Hemorrhage, trauma, surgery, burns, dehydration, you can add diarrhea, vomiting, in all these conditions. So there is less volume. The volume of the blood is less. Since there is less volume, the less venous return to the heart, less cardiac output. So all organs are receiving less blood flow to all the organs. So in all the organs, there is there is less supply of oxygen, that is anoxia. So all organs together have anoxia, all organs will die, multiple organ failure, and that leads to shock. So this is the pathogenesis, and you have to draw it in your exam like this. Say yes if you got it, how to draw it. You should get the approach. Yes, absolutely, Anshita, very correct. The ulcer can be the reason, but in ulcer now, actually little bit of blood is lost every day. It is a chronic blood loss. Here we are talking about the acute blood loss, in which suddenly there is blood lost. In ulcer, hemorrhoids, so little blood loss is there, so body will compensate. But if there is a sudden, you can say, because of the ulcer, if there is a perforation, that can be an emergency. The perforation can lead to shock, but little ulcer do not lead to shock. I will say that, I will add that. Okay, now what are the symptoms? What are the symptoms of hypovolemic shock? I hope you all got the meaning of the hypovolemic shock. What is hypovolemic shock? In hypovolemic shock, due to multiple reasons, what are the causes? The causes can be accident, it can be surgery, diarrhea, vomiting, okay, burns. Due to any of this condition, there is fluid loss. If the fluid is lost, so there is less fluid in the blood. So there is less volume in the blood. That is hypovolemic shock. So there is less venous return. There is less cardiac output, there is less tissue perfusion to all the organs. Less tissue perfusion to all the organs leads to anoxia of multiple organ, and that will lead to shock. That will lead to multiple organ failure, and that will lead to shock. So draw the simple flow chart in your exam, please. Now coming on the symptoms, So to compensate, the heart will increase the heart rate. So tachycardia. Now, if we have 5 liters of blood in us, we all have 5 liters, the healthy human. What is the blood pressure? The systolic is 120 and the diastolic is 80 mm of Hg. But when someone is having less than 5 liters of blood, of course the blood pressure will less now, because blood is less. So it will exert less pressure on the walls of the blood vessel. What is blood pressure? The pressure exerted by the blood on the walls of the blood vessel. Okay. So when 5 liters of blood is present, the pressure is less. But when less than 5 liters of fluid is less, so there is less. So patient will have hypotension. So blood pressure will be less, but the heart rate will be more. The typical combination that represents shock. So patient, if you measure the blood pressure, it will be less. That is, patient is in hypotension. But if you measure the heart rate, the patient will have tachycardia. Okay. Now all the, just suppose this is the diagram of the heart. This is the right side of the heart. This is the left side. From the left side, this is the aorta which is coming out. And this supplies pure oxygenated blood to multiple organs. So this supplies to kidney also. This supplies to brain also. This supplies to all other organs also. So whenever I am saying there is less blood, so all these organs are receiving less blood simultaneously, but most sensitive are two, the kidney and the brain. Okay, whenever there is less blood to the kidney will go in failure. It is known as acute renal failure, ARF. So patient can have ARF and patient can have oliguria because of that. Kidneys are non-functional, patient can have sudden oliguria. Okay, and when brain do not receive enough blood, the patient can have dizziness, vertigo, loss of consciousness. So that can be the thing. Okay, so because of acute renal failure, patient can have oliguria, and because there is less blood supply to the brain, patient can have altered mental status and dizziness and loss of consciousness, like that. So these are the symptoms of hemorrhagic shock, also known as hypovolemic shock. Now there are 3 stages in hypovolemic shock. I told you normal humans have 5 liters of blood, depending how much is lost. Someone is having road traffic accident. It was a minor accident, so little bit of blood is lost. So only less than 20% is lost. What is the 20% of 5 liter, by the way? 20% of 5 liters is 1 liter. Okay, yes, 1 liter. So less than 1 liter is lost. Still more than 4 liter is present. So it is known as mild shock. Here only tachycardia is present. BP is normal. Okay. But if 20 to 40%, I mean 1 to 2 liter is lost, still 3 liter is present. Okay. It is known as moderate shock. Here along with tachycardia, hypotension is also present. But organ status is normal. But if more than 40% is lost, I mean more than 2 liters is lost and less than 3 liters is remaining. So it is known as severe shock or stage 3 shock. Here, along with tachycardia, along with hypotension, patient have disorientation, acute renal failure, and other organ failures. So that is the staging of the shock: mild, moderate, severe, stage 1, stage 2, stage 3, depending how much blood is lost. So we divide the hypovolemic shock into 3 stages: stage 1, stage 2, and stage 3. The stage 1 is known as mild shock, stage 2 is known as moderate shock, and stage 3 is known as severe shock. Massive shock, severe shock. Okay, so here how much blood is lost? Here less than 20% is lost. Here 20 to 40% is lost. And here more than 40% is lost. I mean this percentage is from 5 liter. So less than 20% means less than 1 liter. Here 1 to 2 liter. Here more than 2 liter is lost. And the remaining is present. So what are the symptoms? Here patient have only increased heart rate. Here along with increased heart rate, the blood pressure will also fall. Okay, and here along with these two, the heart rate is more, the blood pressure is less, organ failures are also there. So that is the meaning of the shock. Give me a thumbs up. You have to learn and you have to write like this. So we are done with one shock out of the three. How many of you got it? So if you are getting a short note on hypovolemic shock, first of all, you have to write down the causes. How many causes you remember? Hemorrhage due to surgery, due to road traffic accident, due to vomiting, due to diarrhea, due to burns, due to diuretics. So due to any of the reason, the fluid is lost. So less than 5 liter of fluid is present. What is the pathogenesis? Here I have written in short, you have to draw the complete flow chart. So if fluid is lost because of any of this condition, there is less volume present. So it is less than 5 liter of blood present in someone's body. Because of any of, someone is having diarrhea or vomiting, less than 5 liter. So less cardiac output, less perfusion, and that leads to anoxia of multiple organ, and that leads to shock. So draw that flow chart completely. Right? And in the symptoms, I have told you. So heart rate is more, blood pressure is less, oliguria is there because of renal failure, and altered sensations, altered mental status because of reduced blood supply to the brain. So how many of you got it? It's very simple if you represent like this. Okay, now coming on the second type of shock quickly, cardiogenic shock. Can I start? Say yes. So can I start cardiogenic shock, people? Let's start cardiogenic shock. Now here there is no problem in the volume. I will say complete 5 liter of blood is present in someone's body. You will say, ma'am, then why all the organs together receiving less blood? You are saying 5 liter. Here less than 5 liter blood was present now. So just suppose my body have less than 5 liter of blood due to any of the reason. So all my organ will receive less blood because blood ही नहीं है, blood ही कम है. But here 5 liters of blood is present. Then what is the cause here? The cause is the heart. The heart is not pumping. The left ventricle is not ejecting. So blood is there. There is no problem in the blood. That's why the cardiogenic shock, also known as normovolumic shock, the other name. Because here volume is normal. Here volume is normal. Please understand. Here the main problem is not in the volume. The main problem is in the heart. Got it? So here heart is not pumping. I mean the left ventricle of the heart is not pumping properly. The left ventricle is not pumping properly. So the wall of the left ventricle has some problem. So although blood is there, but since it is not ejected in the aorta, it is not coming in the aorta, it is not distributed in the, so if someone's left ventricle, the wall of the left ventricle is defected due to MI, due to cardiomyopathy, due to tamponade, due to anything, if the left ventricle is not ejecting properly, so less blood will go in the aorta. So less blood is distributed to all the organs. So all organs will have less blood, less perfusion, anoxia in all organ, and all organ failure, and that leads to shock. So I hope you all got it. Here inadequate pumping is the problem. So here main problem is in the heart, and that's why it's known as cardiogenic shock. The meaning of the cardiogenic is the heart. Okay, I hope you got it. So what are the causes? Why? You can see this is the left ventricle wall. When it pumps normally, let me highlight. You can see this is the left ventricle. See the diagram of the heart. You all can see here when the left ventricle do systole, the blood is ejected in the aorta and it is distributed to all the organs, the pure blood. But when the wall of the left ventricle is defective, there is some problem in the left ventricle. The left ventricle is not doing systole properly. So there may be problem in the wall of the left ventricle, that is MI, myocardial infarction. There can be cardiomyopathy, rupture of the heart, ventricle, papillary muscle, cardiac arrhythmias. There can be tamponade, there can be pulmonary embolism, wall thrombus. There can be multiple reasons. Due to any of this reason, you have to learn the list. Okay, learn the list. Due to any of this reason, the left ventricle is not pumping properly. So all the organs together receive less blood. All the organs will have less perfusion. Less perfusion means all the organs have anoxia, and anoxia leads to shock, multiple organ failure, and that leads to shock. Give me a thumbs up if you got it. Got it? Can we go ahead? The grading of the shock PU, once I told you, in the end I will say again. Okay, so let's go ahead. So here the main problem is in the ejection of the heart. Okay, the pumping of the heart, especially the wall of the left ventricle. So there is some problem in the wall of the left ventricle. The left ventricle is not ejecting properly. I told you the list. Learn the list. It can be MI, it can be cardiomyopathies, it can be tamponade, it can be thrombus, pulmonary embolism, like this. So these are the causes. So here we will continue this flow chart. If there is cardiogenic shock, I mean there is defect in any of the problem in the left ventricular wall. So what will happen? The left ventricle is not pumping properly. It will lead to decreased cardiac output. You know what is cardiac output? The amount of the blood, the volume of the blood which is ejected from the left ventricle in aorta in each systole. In each systole, how much blood is coming in the aorta? That is cardiac volume, cardiac output. So the left ventricle is doing a very subtle systole, not a good systole. It's doing very subtle systole. So less blood is coming in the aorta. So cardiac output is less. So blood flow to all organ is less. Perfusion is less. less, all the organs have less oxygen, that is all the organs have anoxia, all organs will go in failure, and that leads to shock. So I hope if you understand, you can draw this flowchart very beautifully in your exam. You don't have to mug up anything in pathology, I can commit. You have to understand, it's a very conceptual subject. So what is the pathogenesis? Here there is circulatory failure. Volume is normal, but when the wall of the left ventricle is starting damaging, if more than 40% of the wall is damaged, then only the cardiogenic shock will occur. If less than 40% is damaging, there will be compensation. But if more than 40% of the wall is damaged, then the systole will be subtle and then it will lead to cardiogenic shock. What are the symptoms here? So here symptoms are same like that of hypovolemic, along with one extra symptom. You see, let me explain. Let me explain the two failure. What do you mean by forward failure and what do you mean by backward failure? Do you understand the two terms, forward failure and backward failure? So let me explain these two terms to you. See the left ventricle here. Everyone concentrate. Have a look on this left ventricle, please. Everyone. Now listen. Normally, when this left ventricle does the systole, where does the blood go? Normally. So of course the blood goes in the aorta. It is ejected in the aorta, and via aorta the blood is supplied to all the organs. The pure oxygenated blood is supplied to all the organs. This is normal. Now this left ventricle is not doing the systole properly. Either it is not at all doing, or it is doing very subtle. Okay, it's not doing a good systole. So here systole, so left ventricular failure is there due to multiple reasons in the wall of the left ventricle. Okay, now it is not doing systole, so of course the blood will not go in aorta. If the blood will not go in aorta, so all organs will receive less blood or no blood. This is known as forward failure. The blood is not going forward, and the symptoms related to this is known as forward failure. Now all organs will not receive blood, but the most sensitive organs are two only, the brain and the kidney. So kidney will go in acute renal failure and the brain will have altered mental status. So these two symptoms are due to forward failure. I agree the blood will not go ahead. So where does the blood will go? My next question, where does the blood आगे नहीं जाएगा भाई, पर कहाँ जाएगा? आगे नहीं जाएगा तो पीछे जाएगा. Blood will not go forward, I agree, but where does the blood will go? Blood will go backward. See ma'am, the blood will go backward in that case. Blood is not going forward, the blood is going backward. So from left ventricle the blood will go to left auricle. From left auricle the blood will go to pulmonary vein. From pulmonary vein blood will go in the pulmonary capillaries and accumulate in the lung, and that leads to pulmonary edema, and pulmonary edema present as dyspnea. This is known as backward failure. So due to forward failure patient have acute renal failure, altered mental status, and due to backward failure patient have dyspnea. So we don't have backward failure symptoms in hypovolemic shock. In hypovolemic shock, we have acute renal failure, we have altered mental status, but we don't have dyspnea there. Here, dyspnea is additional finding. If dyspnea is also present, it's not hypovolemic shock, it's cardiogenic shock. So you understand the meaning of forward failure and backward failure. How many of you got it? The meaning of the forward and the backward failure. Say yes. Say, what is the meaning of the forward failure? What is the meaning? I tried my best to explain you the meaning of the forward and the backward failure. You got it? Please respond. Forward failure, I'm explaining again. If anyone missed it, it will just take 1 minute. So what is the meaning of the forward failure and backward failure? Let me erase it and let me explain you. You all can see the left ventricle. Normally, when the left ventricle does the systole, the blood is ejected. This is the left ventricle. Normally, when the left ventricle does the systole, the blood is ejected in the aorta and it is pure blood is distributed in all the organs. This was normal. Now, the problem is that the left ventricle is not doing the systole properly. So all the organs are receiving less blood. So patient has symptoms because of that. Less blood in the brain, patient have dizziness, loss of consciousness. Less blood in the kidney, patient have renal failure, oliguria. So these are known as forward failure symptoms. Symptoms due to forward failure. The blood is not going forward. The blood is not coming forward. The symptoms are due to that. So where does the blood go? If it is not coming forward, it will accumulate and go backward. So the blood will go from left ventricle to left auricle. It will go to pulmonary vein. It will go in the pulmonary capillaries and accumulate in the lung. It will lead to pulmonary edema, congestion in the lungs, and it will lead to dyspnea. So dyspnea is a symptom due to backward failure. So blood is not going forward, it is going backward and creating symptoms there. So dyspnea is a symptom that is related to backward failure. So here additional finding of dyspnea you have to learn. So we are done with 2 shocks till now, people. Got it? So please see the causes of both of them. Have a look on the causes of hypovolemic shock. Have a look on the causes of cardiogenic shock. I guess you know the causes. Here the causes of the blood loss, maybe surgery, hemorrhage, accident, vomiting, diarrhea, burns, diuretic. Here the left ventricular wall is destroyed. It is damaged either in MI, arrhythmia, cardiomyopathy, tamponade, like that. Here main problem is volume is less than 5 liter. Here main problem, the systole is not proper. The left ventricular failure is there. Okay. Here the symptoms are tachycardia, hypotension, and organ failure. Here along with the organ failure, one additional finding you have to highlight is pulmonary edema leading to dyspnea. That will highlight it here because something unique is there. Now coming on the last type of shock, septic shock, and let me warn you, it's most difficult to understand. I can challenge till now whosoever is attending my session. I don't know whether you know or not, but most of the students don't know the pathogenesis of that. These two shocks are very easy. I guess everyone knows the pathogenesis. It was just brushing up your concept. But septic shock is difficult to understand that how it is occurring. So septic shock here also ultimately there will be less tissue perfusion in entire body. So all the organs simultaneously will get less blood. But the reason is the infection by bacteria. Bacteria, the two type of bacteria, gram positive or gram negative. You'll be thinking, ma'am, bacterial infection, how it will lead to decreased perfusion in entire body? What is the pathogenesis? I will correlate. So let's come on the third and the last type of the shock, septic shock. Septic shock is due to toxins of the bacteria. That's why it is also known as toxemic shock. So sometimes in your exam, you get questions on toxemic shock. So you must understand the meaning of the toxemic is like septic only because bacteria secrete toxin and the toxin is leading to shock. So it is known as toxemic shock. Septic shock. It is due to severe bacterial infection. You know, sepsis. When the bacteria enters the blood, it's known as sepsis. So this is the blood vessel of a human. When the bacteria are present in the blood and goes in multiple organ, it can be gram positive bacteria, it can be gram negative bacteria. It is known as sepsis. Sepsis lead to septic shock. Okay, how I will tell you. So there are two type of bacteria, gram positive, gram negative. So it is two type of shock. The septic shock is of two type. We know that gram negative bacteria secrete endotoxin and gram positive bacteria secrete exotoxin. You may have read this in microbiology, yes or no? So gram negative bacteria secrete endotoxin. It is known as endotoxic shock. And the gram positive bacteria secrete exotoxin. It is known as exotoxin shock. Okay. Okay, got it. So learn the two type of the septic shock. Now the question arises how the bacterial infection leads to shock. Now this is the pathogenesis. Let me simplify it. Wait, don't read this flowchart. Let me convert this flowchart into a diagram. A simple diagram. You will understand very easily. Okay, let me explain. Imagine this is gram positive bacteria. Can you see? It is entered in the lumen of a blood vessel or gram negative bacteria. Both will not come together. Either the person will have infection of gram positive or the person will have infection of gram negative. Whatever. Okay, the person is having infection. The person is having sepsis. Sepsis means infection by the bacteria. Sepsis. Okay, so either gram positive bacteria is present in the blood or gram negative bacteria is present in the blood. Gram positive bacteria. In the cell wall of the gram positive bacteria, there is lipoteichoic acid. Have you read in microbiology the structure of the cell wall? You may have read this, okay? And the structure of the cell wall in the gram negative, there is lipopolysaccharide. So in the gram positive, lipoteichoic acid is present, and in the gram negative, lipopolysaccharide is present in their cell wall. So can you see this is the cell wall? In their cell wall, this is lipoteichoic acid, LTA, and in the cell wall here, this is lipopolysaccharide, LPS. Whatever it is, whether it is lipoteichoic acid or lipopolysaccharide, whatever it is, it will stimulate the macrophage. In the blood, we all have macrophage. It will stimulate the macrophage. So whether it is gram positive bacteria or gram negative bacteria, both of them are going to stimulate the macrophage via different chemicals, different things present in their cell wall. Okay, so the lipoteichoic acid of gram positive bind with ILR2 receptor of the macrophage to activate it, and lipopolysaccharide bind with CD14 receptor of the macrophage. The receptors are different, but ultimate summary is that the macrophage got activated. What will happen next? On activation of the macrophage, the cytokines will be released in the blood. Which cytokines? TNF alpha and interleukin 1. These two cytokines will be released in the blood by the macrophage. What does these two cytokines will do? These two cytokines will do two things. Now please understand. It's difficult. These two cytokines will do two things. Number one, it do vasodilatation. What do you mean by vasodilatation? The blood vessel will get dilated. Imagine this is the organ. This is the organ to which this blood vessel is supplying. See, this blood vessel is supplying to this organ. Okay. Now I'm saying this blood vessel got dilated. You tell me the organ will receive more blood or less blood because of vasodilatation. You use your common sense and tell me, because of vasodilatation, the organ will receive more blood or less blood? I'm asking. Anshika, can you answer? Jayashri, Nikhil, Pihu, anyone who is live, I don't know the names, can answer? Common sense. Now, when the blood vessel get dilated, it's the artery. Okay, when the blood vessel get dilated, when the artery got dilated, so the organ will receive more blood or less blood? Obviously, the organ will receive more blood. You will say, what you are saying? You are teaching us shock. You told the definition of the shock, there is reduced tissue perfusion. In the definition only, you told us that whenever the organ will receive less blood, all the organs will receive less blood, then the person will have shock. And here you are saying that blood vessel will have vasodilatation. Because of vasodilatation, the organ will have more blood, ma'am. It will be reverse of shock. Yes, I agree. So initially, septic shock is very unique. Initially, in septic shock, instead of less blood, the organ is receiving more blood. This is known as hyperdynamic stage. This is known as hyperdynamic stage of the shock. Okay, the organ is receiving more blood. It is vasodilated, no? So more blood is moving to the organ. So because of vasodilatation, more blood is moving to the organ. So instead of getting less blood, the organ is receiving more blood. So you may be thinking, how it is shock, ma'am? Till now, there is no, it is not shock. Yes, I agree. Till now, it is hyperdynamic stage. But the second thing, what the cytokines are doing, I told you cytokines are doing two things. Number one, vasodilatation. Initially it's vasodilatation, so because of vasodilatation the organ will receive more blood, but followed by vasodilatation, the second thing, is increased vascular permeability. What do you mean by increased vascular permeability? You know, they increase the blood vessels are lined by endothelial lining. These are the endothelial cells, I guess everyone know. So there is no gap in that. So normally fluid cannot move out. There is no gap. But due to these cytokines, there is increased vascular permeability. Increased vascular permeability means creation of gaps. The gaps will be formed in the endothelium. So gaps, can you appreciate? I'm making big gaps. The gaps will be formed in the endothelium. Here you can see a gap, here. You can see many gaps are there. From this gap, the fluid will leak out. And that will lead to edema. So edema is a feature of septic shock. Not in other two shock we have seen edema. So edema is a feature of septic shock. So the fluid will leak out. So ultimately in the blood vessel, there is less fluid. Since there is less fluid in the blood vessel, so organ is receiving less blood, and all the organs are receiving less blood, and all the organs are having anoxia, and that is the shock. So initially all the organs are receiving more blood, and followed by some time, all the organs receive less blood. First, why they are receiving more blood? Because of vasodilatation. That is known as hyperdynamic stage. Followed by that, because of increased vascular permeability, the fluid will leak out. There is edema in all the organ, and all the organ will receive less blood now. And now the person will go in shock. Give me a thumbs up. I tried my best. At least I tried, people. I tried. Appreciate my efforts and tell me if you got it or you didn't got it. Give me a gesture. Come on. If you didn't got it, now don't hesitate. Don't shy. Write down in the chat box that, ma'am, please repeat. If you have a slightest confusion, now even although if you have a slightest confusion also, I will repeat. Just tell me. Or if you got it, kindly let me know that if you got it and I should move ahead. Let me know now. You can see me, I can't see you. What I can see is the chat box. So kindly communicate. It's a live session. Take advantage of that. So you got it? Everyone got it? Does everyone got it? This is the pathogenesis of septic shock. So I repeat, what is septic shock? In septic shock, there is bacterial infection. The person is having bacteria in the blood. That is known as sepsis, and sepsis is leading to shock. How it is leading to shock? So bacterial infection can be of two types. Either it is a gram-negative bacteria or a gram-positive bacteria. You can see either it's a gram-positive bacteria or it's a gram-negative bacteria. It can be any of the two. If it is gram-negative, it is having lipopolysaccharide in the cell wall. You can see LPS. In the cell wall, there is lipopolysaccharide. If it is a gram-positive bacteria, it is having lipoticoic acid in the cell wall, LTA. So this is having lipoticoic acid in the cell wall. Whatever it is, whether it is lipopolysaccharide or lipoticoic acid, ultimately it will activate the macrophage. Ultimately, can you see it is activating the macrophage? See simultaneously in the diagram. So it is activating the macrophage via two different receptors. So lipopolysaccharide activate the macrophage by binding. LPS bind with CD14. Okay, here you can see, here LPS is binding with CD14. Can you appreciate? This is LPS, it will bind with CD14. LPS will bind with CD14, because of which the macrophage will get activated. But if it is gram positive, the LTA will bind with ILR2. So you can see it here, the lipoticoic acid is binding with here ILR2. So ultimately macrophage get activated. You have to learn the receptors also. Okay, you can get MCQs sometime on that. And ultimately the macrophage on stimulating secretes cytokines from that. You can see it is secreting the cytokines. You have to learn the name of the cytokines. Interferon, TNF alpha and interleukin 1. It is doing two things. The cytokines are doing two things. What two things? Can you tell me what does the cytokines are doing? These cytokines will do two things. Number one, in a sequence, first they will cause vasodilatation. What do you mean by vasodilatation? This blood vessel will dilate like this. Oh my God, it's dilating. So imagine this is the organ to which this blood vessel is supplying the blood. It's the artery. So initially there was no vasodilatation, and now the blood vessel got dilated. So this artery is supplying more blood to the organ. Because of vasodilatation, there is more blood supplied to this organ. This is reverse of shock. So students may have confusion that in shock, all the organs receive less blood. That is the definition of shock. Reduced tissue perfusion simultaneously in entire body. But here you are saying the organs are receiving more blood. Yes, is it true? Yes. So in septic shock, initially there is more blood. there's vasodilatation. It is known as hyperdynamic stage. But later on, how it leads to shock then? Later on, there is increased vascular permeability. What do you mean by increased vascular permeability? Creation of gaps in the wall of the blood vessel. You can see this is the wall of the blood vessel. So these are the endothelial cells which got separated. So from the endothelial cells which got separated, the fluid will leak out. The fluid will leak out because the gaps are created. So fluid will leak out, it will lead to edema. The fluid will accumulate in the tissue, in the interstitial space. It will lead to edema. So edema is a feature of septic shock, and less fluid is remaining in the blood vessel. So organ is receiving less fluid, less blood, and that leads to shock. So inadequate perfusion leads to septic shock. Everyone give me a thumbs up. Got it. Can we go ahead? This is the pathogenesis. Very frequently, very repeatedly in university exam, you get question on the pathogenesis of the septic shock because the examiner knows this topic is difficult and very few students are able to understand it. Now, what are the symptoms? There are two stages: early hyperdynamic stage, later on hypodynamic stage. In early hyperdynamic stage, because of vasodilatation, patient have tachycardia and warm extremities. This is the third shock I am teaching you. The first shock I taught you is hypovolemic shock. The second shock I taught you is cardiogenic shock. Cardiogenic shock related to the heart. This is the third shock I am teaching you, septic. So in the first two shock, here blood is less. Here overall blood is less. Less than 5 liters of blood is present in the blood because of multiple reasons. Here blood is normal, but the heart is not pumping. The left ventricle is not pumping, so left ventricular failure is there. In both of them, all the organs have less blood. So if you touch the extremities of a patient having these two shock, either hypovolemic or cardiogenic, if you touch the hands or the feet, that is extremities, you will feel cold. You will feel cold hands, cold fingers, cold extremities, cold feet, cold toe. Extremities are cold. But here in hyperdynamic stage, initially if you're touching the extremities, in contrast to these here, it is having cold extremity. Here the extremities are warm. So something unique is there. So you have to highlight the warm extremities in hyperdynamic stage. But later on, when hypovolemic stage, when due to increased vascular permeability, all the fluid will leak out, it will lead to edema, reduced output, and oliguria. Okay, so these are the symptoms. How many of you got it, people? I tried best. Huh? You got it? Absolutely right, Jayashri. Absolutely right. Okay, do you have any query? If you have any query, kindly let me know. Okay, yes. So that is the three type of shock. We are done with shock. So this is the comparative table for your revision, for your last minute revision. Before going to your exam, you should revise this table and you should elaborate it in your exam depending on the marks. If it is coming for long, you have to write down everything with the flow charts, with the diagrams. If it is coming for short, for whatever topic is asked, write that only. Okay. If it is for very short, they will ask only pathogenesis, not other things. Pathogenesis of one of them. So depending what is the mark distribution, you have to frame your answer accordingly. So can we revise it? Can we go ahead? Everyone give me a thumbs up. Okay. So this is for second prof students. You have to frame your answer like this. Okay. Finally, whatever is the shock, whether it is hypovolemic shock or cardiogenic shock or septic shock, whatever is the shock. Okay. Morphological features in the shock are same. Okay, so all the organs are receiving less blood, na? Simultaneously, the reason is different. Here, all organs are receiving less blood because blood is less. Bloody kam hai bhai, less than 5 liters of the blood is present. The blood is lost in multiple reasons. Here, cardiogenic shock, all the organs are receiving again less blood because of left ventricular failure. The left ventricle is not pumping. And here in septic shock, all the organs are receiving less blood because of infection, because of bacterial infection, how I told you. Okay. So the reason is different, but ultimately all the organs are receiving less blood. So in the brain, if brain is given less blood, brain will have ischemic encephalopathy. If the heart is given less blood, it will have coagulative necrosis, that is MI. You know, coronaries have less blood. It will have coagulative necrosis. In the liver, there will be fatty change with hemorrhage and central necrosis. In the kidneys, there can be acute tubular necrosis. In the adrenal, there can be cortical cell lipid depletion. In the GIT, there can be hemorrhagic enteropathy. So that is the morphology. That is the morphology in multiple organs. We are done with shock. Can we revise? Now, people, if it is coming for a long question in your exam, you have to write down everything. Start with the definition of shock. What is shock? So learn this overview. Learn only overview, not inside that. Inside that, you can elaborate in your own words, in your own language. So what is the definition of shock? The definition of shock in one word, it is decreased tissue perfusion in entire body due to multiple reasons. If all the organs are receiving less blood, so all the organs will have anoxia, less oxygen. So all the organs will go in failure, multiple organ failure, and that leads to shock. So shock is not a disease, it's a syndrome. Okay, that is the definition. In the classification, we have seen there are three types of shock: hypovolemic shock, cardiogenic shock, and septic shock. You have to write down the introduction, causes, pathogenesis, and symptoms of each of them, and we have drawn a beautiful table to compare them. Okay, so can we move ahead? The next topic, now have a look on the university exam question of shock, which are asked in previous year of various universities throughout the country. Okay, so you are prepared for whatever long question they can ask you. The long question can come on overall shock. The long question can come on one of the shock. Any one of the shock they can ask you. Either usually they ask you on the septic shock or hypovolemic shock. So you have to write down that only. So whatever they ask, whether it is long, short, or very short, you are prepared. Okay, so can I go to the next topic? Can we start the next topic? You are loving this pattern, you are liking this pattern. So this pattern is exclusively designed, again I repeat, it is for second prof students. It is for answer writing, Hannah. So preparation is little bit different. Here if you say ki ma'am we have to prepare for NEET PG, so I will teach you the shock in the same way, but I will give you a set of MCQs which are based on that, and I will give you the approach based on the MCQ. I will not give you this overview, and I will not ask you to learn this overview, you have to frame your answer like that. In that the approach is different, but concept will remain same. Okay, so here approach based study we are doing. Got my point? So the entire syllabus we are going to cover like this only. Okay, so before moving to the next topic, let me give you a little bit let me say something to you. Don't be busy, be productive. I guess you know the difference of being busy and being productive. So always remember, okay? So you have to be productive. At the end of the day, you must be satisfied with your output. So before going to your bed, you should think that what was my target today and have I achieved it or not? So that is your productivity. Although you are busy the whole day, you are studying something, blah, blah, blah. But at the end of the day, if you don't retain it, it doesn't matter. You have studied for 8 hours or 18 hours. So although if you study less also, it's okay, but study with concentration, and whatever you are studying, it should fit in your memory and you can retain it later on in your exam. That is the point. So we are done with one of the important topics today, shock. Let's move on the second topic, thrombosis. Can we go ahead? Thank you so much. Thank you for your feedback, Anshita. Thank you. So let's go to the next topic, thrombosis. Can I start thrombosis? Let's start the next topic in the same way, thrombosis. So as I told you, first have a look on the university exam questions which are asked from the thrombosis in your previous year questions. So have a look on the long question, short question, very short question. I will show you this list again in the end. Let me explain you the thrombosis completely. So the first thing I always tell the students to learn is the overview. So if thrombosis is coming for a long question in my exam, how I am going to write it? I'm framing the answer into multiple headings. So the headings should be clear in my mind before I touch the pen and start writing. So I will write and frame my answer under these headings, and please follow these guidelines. Okay, whether you join the batch or doesn't join the batch, it's up to you. But ultimately you have to follow these guidelines. If you're a second prof student or you are any prof student, for your university exam, the generalized guidelines in the long question, you have to frame your answer under headings. Clear headings. You have to draw maximum flowcharts. You have to draw maximum images. Wherever there is a catchy word, there is a concept, you have to underline it with a different color pen. You have to highlight it. If you are following these commands and these rules, whatever you say, these guidelines, nobody is going to stop you from getting distinction. Take my challenge. The studies are very easy. You know, you should get a proper channel how to go with that. That I think so. Okay, anyways. So let's go to the next topic, that is thrombosis. Okay, so first of all, I will let you know what do you mean by thrombosis. Most of the students don't know कि मैम होता क्या है thrombosis, मतलब क्या होता है, what do you mean by that. Okay, after that we will understand what is the pathophysiology, why does it occur, what is the cause. Pathophysiology means cause. What is the cause of that? What is the reason for that? After that, we will see the types of the thrombus. How many types of thrombus is there? First, see what is thrombus, then the causes of thrombus, then the types of thrombus, then its gross, then the differences between the two types of thrombus, the arterial and the venous one, and finally fate. Uska hoga kya future mein? What is the fate of the thrombus? So first learn the headings, then we will see the details inside that. Let's start the topic thrombosis. Okay, let me ask you a question. Imagine I got an injury over here. Here, I got a needle prick injury or any injury. Not only here, I got any part of my body. If any part of my body got injured, what will happen? You will say, ma'am, you will bleed. Everyone bleed. When someone have injury, we have bleeding. Of course. Huh? So my next question, how long I bleed? How long I bleed? Huh? So you will say, ma'am, for few minutes, few seconds to maximum few minutes you will bleed. What happens after that? You see, ma'am, bleeding stop automatically. Bleeding stop. Bleeding stop. How is bleeding stop? See, ma'am, automatically. Huh? So that is the mechanism known as hemostasis. Thankfully, God has given us this inbuilt mechanism that is known as hemostasis. Thankfully, God has given this physiological mechanism in us. What do you mean by hemostasis? Hemo means bleeding. Stasis means stoppage. So it is the stoppage of bleeding automatically after we injured. So if I have a cut, injury anywhere on my body, I will just compress it. If it is minor, I will just compress it for few seconds or minutes. After that, I see it stop automatically. So there is a breach now. There is a breach in the blood vessel. So the blood is coming out. We have 5 liters of blood. I'm having 5 liters of blood. Imagine if hemostasis is not working. Okay. And I have a cut. So I will continue bleeding, continue bleeding, continue bleeding. And after some time, we can go in hypovolemic shock. The blood will get less and less and less. But thankfully, we don't go it. So whenever I have injury, I don't think that I will have hypovolemic shock unless until the blood loss is very severe suddenly, like in accidents and all. But we all have hemostasis. So hemostasis is a physiological phenomenon. So how does hemostasis takes place? Let me draw a blood vessel for you. Let me draw a blood vessel for you. Okay. And see, here I am drawing the endothelial lining. Here I am drawing the defect in the endothelial lining. So this is the site of the injury. At this point, the injury is there. There is a breach in the blood vessel and the bleeding is taking place from this point. So body automatically seal that. Okay, this is known as hemostasis. So in hemostasis, the platelets will come. Platelets will seal this area. This is known as primary clot. This is known as primary clot. So that blood stop and bleeding is not coming out. This is known as primary clot made up of platelet. The platelet is sealing this area. But this is very fragile. If you don't stabilize it, it will re-rupture and bleeding continues. So to stabilize it, we have to convert it into secondary clot. So how primary converted into stable secondary? In secondary clot, we need fibrin. Fibrin is a thread, dhaga, rope, jo kehna hai keh lo. So fibrin is like a thread. It's a thread. It will tie over the primary clot and the primary clot get converted into secondary clot. Fibrin is coagulation factor number 1. Okay. In the blood, we have 12 coagulation factors. I guess everyone knows in physiology, factor number 1 to factor number 12. They are normally inactive, but whenever the bleeding takes place, at that time, they all will become active and the activation of the one is fibrin. Fibrinogen get converted into fibrin and here the rope will tying it and primary clot convert into secondary clot and now the bleeding stops. So as soon as I have the bleeding, first primary clot will form here. The platelet will come and seal this area. Platelet will come and seal this area. Then the fibrin will get activated and it will convert the primary clot into secondary clot and bleeding stops here. Till healing occurs, the bleeding is stopped. So I don't have any problem. You will say, ma'am, why you are teaching us this topic? Come on. You are teaching us thrombosis. Huh? What does thrombosis teach that? Why you are teaching us hemostasis? Listen, I cannot teach you thrombosis until you don't know hemostasis. So let me tell you what is thrombosis. You tell me what is thrombosis. Here I am drawing it. See, I am drawing another blood vessel. But the only point, it is not injured. There is no injury. Okay. Without injury, if such a clot is formed, again the platelets are coming. The platelets are coming and forming the primary clot. These are the platelets like this only. And this is the fibrin. This is the fibrin like this only. So you will say, ma'am, it's exactly same. The primary clot and the secondary clot you are saying. But the only thing, the blood vessel is not injured. So if after injury, the clot is formed, it's useful for us. And the mechanism is known as hemostasis. It's not a disease. It's physiological and it's useful. But if without injury, the same clot is formed inside blood. Imagine the blood vessel of someone and I don't have any injury. But without injury, inside my blood, multiple clots are formed. So this is something wrong. Okay, this is a disease and the name of the disease is thrombosis. And the thing which is formed here, no, I will not call it a clot. I will call it a thrombus. I will call this as clot. Although the composition of this and this is exactly same. Both of them contain the platelet. Both of them contain the fibrin. The primary and the secondary. I agree. But I will call it clot, which is normal. I will call this thrombus, which is abnormal. Okay, clot is useful for us because it is preventing the bleeding so that we don't go in shock. Imagine I have a cut here, so I will bleed if the clot is not formed. So thankfully, the clot is formed and bleeding will stop. It's useful. It's physiological. But imagine I don't have any cut anywhere and inside my blood vessel, anyone's blood vessel, multiple clots are formed. So it's abnormal. I will not call it clot. I will call it thrombus. And the mechanism is thrombosis. It's harmful. It's a disease because it is causing the obstruction in the flow of the blood. So that will lead to ischemia in multiple organs. That is thrombosis. How many of you got it? Huh? How many of you got it? Give me a thumbs up. Hello. So you got it? Huh? Can we go ahead? So I hope you got the difference between the hemostasis and the thrombus. You can't understand thrombosis unless until you don't understand hemostasis because the steps, the composition, everything is same with only one difference. Here the blood vessel is injured and here the blood vessel is intact. There is no injury. That is the only difference. Got it? So now read the definition. You will definitely understand it. You can see here we are looking for the definition of hemostasis versus thrombosis. So can you tell me what is the difference between hemostasis and thrombosis? Hemostasis is formation of clot after injury. Okay, and it is useful for us because it is preventing the fluid to escape out and stopping the bleeding. But thrombosis occurs in unruptured blood vessel without injury, unruptured, and it's harmful. It's pathological because it is creating the obstruction in the flow of the blood and it will lead to ischemia of multiple organs. So that is thrombosis. I hope everyone got it. I hope so. See it. Can you see here the thrombus is forming? Can you see? So here the platelets are coming and forming the clot. Platelets are coming and obstructing the flow of the blood vessel. How many of you got it? See here, the blood vessel is not injured. The blood vessel is not injured. So without injury, if the clot is formed, platelet and fibrin, it is known as thrombus. So this is thrombosis. I hope you got it. So first, I will tell you the steps of hemostasis. If you understand the steps of hemostasis, they are the same steps of thrombosis. Hemostasis and thrombosis, the steps are same. The only thing is the injury. Hemostasis and thrombosis are one and the same thing. Here it occurs without injury. Here it occurs, hemostasis occurs after injury and thrombosis occurs without injury. So the steps are same. If in your exam, they are asking you the steps of the thrombus formation, you have to write down the steps of hemostasis only. Steps are same. The only thing you have to highlight in your exam, you have to write it occurs without injury. Okay, so the unruptured blood vessel, you must say, better word. So let me tell you the steps of the hemostasis versus thrombus, whatever you say, they are same. Okay, so let me tell you. Okay, so you see there is an injury here. Whenever there is an injury, can you see the platelets are passing in the blood? The platelets will come, the blue color are the platelets. They will come and they will form a row here and they will seal this area. They will seal this area. Can you see? They are sealing the area. Then more and more platelets are coming. They are sealing the area. So particularly a clot is formed. So this clot is known as primary clot. The primary clot is exclusively made up of platelet. Okay. Let me draw it for you to explain you the further details. Okay. So this is the blood vessel. This is the lining of the blood vessel, endothelial lining. Here is the injury. You can see. Okay, whenever there is injury, I got a prick over here. So these are the platelets. These were passing from here. These are not RBCs, not WBCs. These are platelets. The platelets will come and seal this area. Seal this area like this. The platelet will come and seal with this area. So the first row of the platelet, which is coming here, forming a bond with the subendothelial tissue. They will form a bond with the subendothelial tissue. They have receptors on them to form this bond. So this is known as platelet adhesion. So first step is platelet adhesion. Adhesion means formation of bond between the platelet and the subendothelial tissue. So receptors are present, glycoprotein 1A, 2A, other receptors are present. Okay. Now after that, these platelets have granules inside them. The platelets have granules inside them. All platelets have alpha granules and delta granules. They will release the granules out to call the other platelets for help. That we need help. Come everyone here. All the platelets, we have to make a clot. So they will call other platelets for help. This step is known as activation. Activation means secretion of the granules to call other platelets for help. Now, finally, other platelets will come and they will form bond with platelet. So multiple. So this is the second row. This is the third row. This is the fourth row and multiple subsequent rows. So finally, a clot is formed. So this is known as platelet aggregation. In aggregation, the platelet is forming the bond with platelet. So receptors are different. Okay, I'm not interested here in receptors. I will teach you the receptors in detail when I will teach you the platelet unit. Okay, I will teach you this again in detail. Here I'm teaching you thrombosis, but understand there are three steps: adhesion, activation, aggregation in this sequence. So tell me the meaning of that. Tell me the meaning. So first row always show adhesion, the first row of the platelet. Can you see this row of the platelet? This one. It is showing adhesion, means formation of bond with subendothelial tissue. Then secretion of the granules out is known as activation. And then other platelets will come and they will form bond with platelet. So all subsequent rows will show aggregation. So aggregation is formation of bond with platelet. And adhesion is formation of bond with subendothelial tissue. How many of you got it? So this is primary clot. Okay. Now let me tell you how does the secondary clot will form. This clot is very fragile. So I will draw the primary clot again in short. You can see. You all can appreciate this is the site of the injury. And here the primary clot is already formed. You can see this is platelet adhesion. This is activation. And this is aggregation. So because of platelet adhesion, activation and aggregation, the primary clot is in front of you. You will say, then what is the problem? The injured area is sealed. and the bleeding is stopped. What is the problem? Why you want to convert primary into secondary? I want to convert primary into secondary because primary clot is very fragile. It will re-rupture and bleeding starts again. I do not want that. I cannot afford that. So I want to stabilize it. So in all of our blood, your blood, my blood, in all of us, coagulation factors are present. How many coagulation factors are present? Have you read this in physiology? Factor number 1 to factor number 12. 12 factors are present. Okay, but they are all inactive. So we have to activate them. I need factor number 1. Out of the 12, I am interested in 1. What is the name of the one? The name of the one is fibrinogen. This fibrinogen get activated and convert into fibrin. So I want to activate 1. But the problem is that out of 12, I need only 1. But I cannot activate 1 directly. I have to activate all 12. This is known as cascade. So intrinsic pathway, extrinsic pathway, common pathway. Ultimately, last step is 1 get activated. So to activate 1, you have to do multiple steps. The last step is 1 get activated. So by intrinsic or extrinsic or common pathway, ultimately 1 get activated. 1 is like a thread, like a rope, है ना, रस्सी की जैसा है, धागे की जैसा है. It will tie over the primary clot. Now I will not call it primary clot. I will call it secondary clot. So the primary clot contain only platelet. But secondary clot, along with the platelet, it contains fibrin. So that is the difference. I hope you got it. So secondary clot is formed. Now thing is stable. Till the repair takes place, healing takes place, it will remain there. And this is the steps. These are the steps. Okay, got it, everyone? Huh? So the same thing you can see it here. Okay, I will show you the images and the videos, and then we will come on thrombus. So these are the steps. How does the thrombus form? First of all, the primary clot is formed. You can see here in the diagram, primary clot is made up of platelet. You can see the green colored platelet. So this step is showing adhesion. You all can see this step is showing adhesion, this row. Then it is secreting the granules, that is activation, and then platelet over platelet is aggregation. So platelet adhesion, activation, aggregation. Platelet adhesion is formation of bond between platelet and subendothelial tissue. This is known as adhesion. Activation is secretion of granules out, so that to call other platelets for help. And aggregation is formation of bond between platelet and platelet. Because of these three steps, ultimately primary clot is formed. Now I have to convert the primary clot into secondary. Let me show you how the primary is formed. See, this is adhesion. Can you see the defect? See it again. See the defect. See the platelet, white colored platelets are coming. The first row which is coming and sealing the defect, this is the first row, it is adhesion. Now subsequent, they will do the release, the secretion of the granules, that is activation, and they will call other for help. Let me show you another video. See this video. First, the first row is formed, adhesion, and then subsequently others are coming, and finally the aggregation, the primary clot is formed. See, the coagulation factors are also coming, and the rope will come. Can you see the yellow color thread or rope which is tying over that? See it again. First, the primary clot is formed because of platelet. See, this is the primary clot. It is formed of platelet. Now, see the coagulation factors are coming. They are getting activated. Finally, factor 1 is getting activated and it will tie over it. It is tying over it. See the ropes in the video beautifully. So, this is the primary clot get converted into secondary clot like this. Okay. So, how the primary clot get converted into secondary clot? For that, you need factor number 1. Factor number 1 is fibrin. Okay. So, there are 2 pathways. You cannot activate fibrin directly. So you have to learn the 2 pathways. Either by intrinsic pathway or extrinsic pathway, you can activate it. So in intrinsic pathway, factor number 12 is getting activated. 12 leads to activation of 11. 11 leads to activation of 9. 9 in presence of 8 leads to activation of 10. 10 leads to activation of 5, 2, and finally 1. Okay, I will tell you again on the next page. And in extrinsic pathway, it is factor 7 only. 7 directly get activated, activating the 10. I guess you have read this in your physiology. Yes or no? So let me tell you intrinsic pathway and extrinsic pathway in an easy way. Okay, learn the sequence. I need 1, but 1 will come in the last. Okay, so first 12 will come. 12 will lead to activation of 11. 11 will lead to activation of 9. Okay, 9 will lead to activation of 10. 10, 5, 2, 1. Learn the sequence. Okay, learn the sequence. I am saying it again the last time. So in intrinsic pathway, the sequence is 12, 11, 9, 8, 10, 5, 2, 1. You have to learn it by heart. Okay. In extrinsic pathway, it's factor 7 only. It will directly lead to activation of 10, 5, 2, 1. Okay. So this is common, which is coming in both. These 4 are common, 10, 5, 2, 1. I'm interested in 1. Okay. So this is coming in both. So if I say intrinsic pathway, you have to learn these 8. That is 12, 11, 9, 8, 10, 5, 2, 1, ultimately 1. But if I say extrinsic, you have to say only 5. So 7 followed by 10, 5, 2, 1, ultimately 1. So if you learn the numbers, it's good for you. So ultimately 1. What is 1? Say, ma'am, 1 is fibrinogen. So here fibrinogen get converted to fibrin. fibrinogen get converted to fibrin. I am interested in fibrin because fibrin मेरी रस्सी है, धागा है, it's my rope. It will tie the platelet and convert the primary clot into secondary. So in this diagram, if you can appreciate, a yellow color rope is there that is tying over the platelet and converting a primary clot into secondary. So that is the thing. So whether it is extrinsic pathway or intrinsic pathway, I'm not interested. Ultimately, it's factor 1, and factor 1 will make a meshwork. Meshwork means रस्सी से बन जाएगा. It will be like a thread, it will be like a rope, and it will convert the primary clot into secondary. So first, you see, this is meshwork. This is activation of 1. The meshwork, the rassi, the rope, the thread, you can see, and it is tying over the primary clot and converting the primary clot into secondary. Say yes, got it, huh? So that is the steps. So what I taught you till now, let's revise. I told you the topic, I'm teaching you the topic thrombosis, whatever you say. Okay, first thing I told you is the definition. What is thrombus? What is thrombosis? I told you that. So I told you it is related to hemostasis, but it is different from hemostasis. In hemostasis also clot is formed, but it is after injury. In thrombus also clot is formed, but in an uninjured blood vessel. So you have to write down in definition. After that, I told you the steps of formation of thrombus. The steps are same as that of hemostasis only. So the first step is primary clot formation. Second step is secondary clot formation. Primary clot made up of platelet, only platelet. So first platelet adhesion, then platelet activation, then platelet aggregation. Explained you. Here in secondary clot, platelet is already there, but we have to stabilize it by making it fibrin. So activation of fibrin require intrinsic or extrinsic pathway. So till now we have studied this. Okay, now let me come on the third thing. The third thing is the pathogenesis. The pathogenesis of the thrombus. Then we will come on the type of the thrombus. So the main important thing is the pathogenesis. You may be asking, ma'am, why? Why without injury the clot is forming? You told us whenever you have an injury over here, you are bleeding, so the clot is forming. That we can understand. That is hemostasis. But why? I'm sorry. Why? Just a second. I cannot see your comments. Let me open it again. Why without injury the clot is formed? That is the pathogenesis. So there are 3 reasons. That is known as pathophysiology. Who discovered the 3 reasons? A scientist, a person. The name of the person is Virchow. And the 3 reasons are known as Virchow triad. So without injury, I don't have any injury anywhere. Still inside my blood, small clots are forming. That is thrombus are forming. Why? So there can be 3 causes. Number 1, endothelial injury. So my point is that, listen, this is a blood vessel. This is the blood vessel. This is the endothelial lining. And you can see here through and through perfo is there. So there is disruption in the wall of the blood vessel if I got a pinprick injury there or I got any injury, severe injury there. So the blood is coming out and bleeding is taking place. Here bleeding occurring because there is a gap, there is a defect from which the bleeding is coming out. The blood is coming out. Okay, so this is the injury. So it is causing a defect in the wall of the blood vessel from which bleeding is taking place. So we immediately want the platelet to come and seal it and form the primary clot, and then the primary clot convert into the secondary clot. This is known as hemostasis. But here, I'm not saying this. I'm saying the blood vessel is there. It's intact. Only endothelium got injured. So bleeding is not coming out. You know, the blood is not coming out. The endothelium got injured, but the wall is intact. You're getting my point? The endothelium is intact. Endothelium got injured. You can see the endothelial cells are missing here. The endothelial cell got ruptured. It got injured, but the wall is intact. So bleeding is not taking place. So we don't require any clot formation here. The function of the clot formation is to stop bleeding. Here there is no bleeding. No. Here there is no bleeding. We don't have bleeding here. The only thing, the lining got ruptured or injured, but the wall is still intact. Okay, there is no bleeding. So we do not want the clot. But sometime after endothelial injury, the clot is formed. And that I will not call it a clot. I will call it thrombus because it is forming without bleeding. So endothelial injury is one of the cause. I hope you got it. Say yes if you got it. Say yes if you got it. That is the first thing. The second thing is altered blood flow. Altered blood flow. I'm coming on your point, Anshita. Wait. Okay. Altered blood flow. What do you mean by altered blood flow? So first thing is endothelial injury. The first thing is endothelial injury I taught you. The second thing is altered blood flow. What do you mean by altered blood flow? Have you read Bernoulli's theorem in physics? Whenever you were in 7th, 8th or 9th standard. In physics, everyone have read it. Bernoulli's theorem. You may have read that. What is Bernoulli's theorem? Bernoulli's theorem states that whenever fluid travel in a pipe, so the heavy portion of the fluid travels at the center. Okay, and the light travels at the periphery. That is the Bernoulli's theorem. I guess everyone knows that. Let's apply Bernoulli's theorem on a human blood vessel because human blood vessel is also a hollow pipe. Can we apply? Yes, of course. So in the human blood, there are 4 things: RBC, WBC, platelet, and plasma. The 3 cells and the plasma. Who is the heaviest? Heaviest is the WBC. So WBC travels at the center. Apart from that, the RBCs and platelet, they surround the WBC. RBCs as well as platelet. The platelets, they surround the WBC. But my point is that lightest is the plasma. Among them, the most lightest is the plasma. So plasma will come at the periphery. The plasma will come at the periphery. Plasma always come at the periphery. This blood flow is known as axial blood flow. So we all have axial blood flow. This is normal. So we are applying Bernoulli's theorem here. So my point is that platelet never come in contact with endothelium directly because there is a layer of plasma which is separating the platelet from the endothelium. There is always a layer of plasma which is separating the platelet from the underlying endothelium. Say yes if you are getting it. This is known as axial blood flow. Okay, now imagine this is in flowing blood. You know, blood is never stasis. In our entire body, the 5 liters of blood keep flowing, keep flowing, keep flowing, keep flowing, keep flowing. So whenever the blood is flowing, this theorem is applied. But imagine due to any reason, there is stasis of the blood. The blood is not flowing and the stasis. In this portion, the blood is not flowing. It is stasis. So remember another physics law, Newton's law, gravity. Newton discovered gravity? Yes or no? So Newton's gravity is the, it is functional all the time, whether we are aware or not. So due to gravity, the heavy things will fall. So all the cells will fall here. So RBCs will also fall, the WBCs will also fall, and my point is that the platelets will also fall. So when the platelet will fall, it will come in contact with the endothelium and it will form a clot. So stasis, that is altered blood flow. So this is how the stasis or the turbulence of the blood can lead to clot formation. Normally, there is axial blood flow, also known as laminar blood flow. What is axial or laminar blood flow? In this axial or laminar blood flow, the platelets are separated from the endothelium by a layer of plasma. So platelets are not coming in contact to the endothelium. So they are not forming the clot. They are not forming the bond. You know, the first step in clot formation is adhesion. Adhesion is formation of bond between platelet and subendothelium. So here platelet are not coming in contact with subendothelium. How it will form the clot? Got it? But here, due to stasis, due to gravity, you know, it is coming down and it can form a clot. That is the thing. The same thing is shown to you. Here you can see all the cells travel at the center and you can see there is a clear plasma at the periphery. At the periphery, there is a clear plasma. But due to stasis or turbulence, the cells are coming in contact with the endothelium, especially the platelet, and they can form a clot. So that is the second reason. And the third reason is the hypercoagulable state. The third reason, I'm telling you there are 3 reasons now. In the pathophysiology, there are 3 causes of thrombus formation. One is endothelial injury. The second is altered blood flow, that is stasis or turbulence. You have to apply Bernoulli's theorem here. And third is hypercoagulable state. What do you mean by hypercoagulable state? You know, we all have blood. So you may be thinking, ma'am, why normally clot is not formed in all of us? In all of us, the platelets are also present. Okay, in my blood, in your blood. And in all of us, the coagulation factors are also present. Factor number 1 to factor number 12. So why the clot is not formed in running blood without injury? Because along with the coagulation factors, the 12 coagulation factors, in my blood, anticoagulation factors are also present. So in human blood, normal, healthy human blood, coagulation factors and anticoagulation factors both are present. Okay, and they neutralize each other, they balance each other. So in my blood, the coagulation factors are present, factor number 1 to 12, but anticoagulation factors are also present. So they balance each other. But whenever someone have injury, just suppose I got a cut over here. So whenever someone have injury, immediately at the moment we have injury, coagulation factor concentration increases and anticoagulant concentration decreases. So the clot will form and we require that. It's necessary, we require that. Okay, but sometimes without injury, if this imbalance occurring, if without injury, due to any reason, either the coagulation factors are increasing or anticoagulation factors are decreasing, this blood is abnormal blood and this is known as hypercoagulable blood. Because now without injury, it will form the clot and that is a thrombus. This is known as hypercoagulability. How many of you got it? So can you list the coagulation factors or anticoagulation? So there is a list of coagulation, anticoagulation factors, and due to any reason, maybe hereditary or acquired, if the coagulation factors concentration is increasing and anticoagulation factor concentration is reducing, that blood is known as hypercoagulable blood. So there can be hereditary factors, there can be acquired factors. How many of you got it? How many of you got it? Now coming on the types of the thrombus. Can I move ahead? Say yes. So till now I told you 3 things. I'm teaching you thrombosis. I told you the definition of the thrombosis, I told you the steps of thrombus formation, and I told you its pathogenesis. The most important is pathogenesis, which you get question in your exam as a short or very short. What is the pathogenesis? What is Virchow triad? In Virchow triad, we have 3 components. Can you say it? Can you say it once? What are the 3 components of Virchow triad? What are the 3 components? Number 1, endothelial injury. Endothelial injury. No bleeding, but endothelial is injured. So, but there is no bleeding. Endothelial injury. Number 1. Number 2, altered blood flow. Altered blood flow, that is stasis or turbulence. I have explained you. And number 3, hypercoagulable blood. So I've explained you all of them. Okay, so you have to explain in your words in your exam and write down the details of that. So don't mug up, just understand. Now the next thing I'm teaching you the types of the thrombus. How many types of thrombus are there? Huh? There are 3 types of thrombus. So thrombus can be formed in the artery, it is known as arterial thrombus. It can be formed in the vein, it is known as venous thrombus. Sometimes the thrombus is formed in the heart, it is known as cardiac thrombus, and these are in the form of the vegetations. So currently I'm not teaching you the cardiac thrombi. Cardiac thrombi I will teach you whenever I will teach you heart unit, heart chapter. I will teach you complete pathology, na? So I will teach you heart also. I will discuss the vegetations or cardiac thrombi there. Currently I'm interested in other two, the arterial and the venous one. So see, have a look on the diagram. Have a look on the diagram. Everyone come here. See, can you see the organ here? Say yes. This is the organ. This is the artery supplying pure blood to the organ. See the arrow. This is a vein carrying the impure blood away from the organ. See the arrow. See the arrow. Got it? Now listen. The thrombus can be formed in the artery. The thrombus can be formed in the vein. Okay, it is without injury. There is no injury, no bleeding. So even without bleeding, the clot is forming. Here also no bleeding, no injury. Here also no bleeding, no injury. Clot is forming without that. So arterial thrombus, venous thrombus. Now enumerate the differences between them. I can show you this table and ask you to learn. I know, in a boring way. No. We will not learn this table. We will understand the differences here. Then I will show you this table. Please see the differences between arterial and venous thrombus. The first thing, see their color. Arterial thrombus, intentionally I have drawn yellow color. Actually, I don't have white color now. It is a white. It is known as white thrombus. I have shown you yellow, but you can learn white because it is having more platelet inside that, and platelets are whitish in color. That's why it is white. And the venous thrombus is red in color because it is having more RBCs inside that. So learn the composition, learn the color. Learn the composition, learn the color. I'm coming on embolism, Akshita. My next topic is embolism only. Let me finish it. Okay. 5 more minutes. After that, we will take the third topic, that is embolus only. Okay, listen. So white thrombus is arterial one, the red thrombus is the venous one, number 1. Now see, arterial one is not occluding the lumen completely. See the lumen of the artery. The arterial one is not occluding it completely, it's occluding it partially. Still blood can flow from here or from here. Okay, the blood can still flow. It's partially occluding, I mean. So it is known as mural. Mural means partial. It's partial, but see the venous one, it is through and through. It is occluding the vein through and through, packed completely. There is complete stoppage of the blood flow. It is known as occlusive. Occlusive means completely obstructing the lumen. That is the difference. You can learn in the diagram. Okay, the third thing. Can you see the arterial one? Inside the arterial one, I have drawn the light, dark bands. These are known as lines of Zahan. Lines of Zahan are present in arterial one. I will explain what are they. But in the venous one, I have not drawn such line. There are no such lines here in the venous one. So here the lines of Zahan are absent. You will say, what are lines of Zahan? I told you now, the primary thrombus is made up of platelet and the secondary thrombus is made up of fibrin. And along with that, here RBCs are also impacted there. So one layer of platelet and fibrin, one layer of RBC, one layer of platelet and fibrin, one layer of RBC. So it is like that. So alternate zones are seen as a light, dark bands. These are known as lines of Zahan. So please learn lines of Zahan are present in arterial one, not the venous one. Okay, say yes. Say yes, everyone. Now, one more thing. See the arterial one, see the venous one. Have a look in the diagram. See the point where they are arising. So this is the point of their origin in the artery. And the blood is flowing in this direction. But after arising, the thrombus will grow in opposite direction as that of blood flow. So that's why they are known as retrograde. So from the point of origin, they grow in opposite direction, the arterial one. They grow in opposite direction from the point of origin as compared to blood flow. These are known as retrograde propagation. In contrast to that, see the venous one. The venous one are arising from this point. After arising from the point, they grow in the same direction as that of blood flow. These are known as antegrade propagation. So please learn the propagation of both of them. Got it? Learn the propagation of both of them. Now please use your common sense and tell me a thing. You use your common sense and you tell me one thing. If the artery get obstructed, what will happen? What is the effect of both of them? You imagine here the artery got obstructed. So the pure blood is not supplied to the organ. So organ will have ischemia. So the arterial thrombus will lead to ischemia because it is a pure blood. It is an obstruction in the pure blood. The organ is receiving less pure blood. That's why the organ will have ischemia. What is the effect of the venous one? There is no arterial one, but venous one. So pure blood is coming to the organ, but impure blood is not leaving the organ. So impure blood will accumulate inside the organ and that will lead to edema. So arterial thrombus leads to ischemia, but the venous one leads to edema. How many of you got it, people? I tried my best. Can we revise the differences quickly between the arterial and the venous? So tell me how many type of thrombus are there? Actually, there are 3 type of thrombus, arterial, venous and the cardiac. But cardiac we will deal later on. Currently, I am interested in arterial and venous thrombus. Arterial thrombus formed in the artery, venous thrombus formed in the vein. You can see the diagram. Tell me the color. The arterial one are white in color Because they have more platelet, the venous one are red in color. Tell me their obstruction. Arterial one partially obstruct the artery. That's why they are mural. Venous one completely pack the artery, obstruct the artery. That's why they are occlusive. Lines of Zahan are present in arterial, absent in venous. Arterial one grow in opposite direction as that of blood flow. That's why they are retrograde. But venous one grow in the same direction. They are antegrade in propagation. So arterial one leads to ischemia and venous one leads to edema. I don't think you have to learn even a single difference. You can understand it. Say yes if you're getting it. You have to understand it. Say people, yes, say. So you can see the differences between the arterial thrombus and the venous thrombus. Say yes, the differences. Huh? So arterial thrombus here mainly occurs in coronary, cerebral and femoral artery. Venous one occurs in the deep veins of the leg. So learn the most common artery, most common vein. They grow in retrograde manner, they grow in antegrade manner. Here lines of Zahan are present, here lines of Zahan are absent. These are pale or white in color. These are red in color because RBCs are there. So these are red in color. Here the obstruction is incomplete, that is mural. Here the obstruction is complete, that is occlusive. Here the effect, they will lead to ischemia and infarction. And here the effect, they lead to edema and ulceration. I hope you got it. Everyone got it. Here blood flow is active, here sluggish. You can say that. Okay. Can we move ahead? Huh? So these are the differences. These are the lines of Zahan I was talking about. So you can see in the lumen, this is the artery. In the lumen of the artery, you can see a thrombus. Without injury or clot is formed, I will call it thrombus. You can see alternate light, dark bands are there. The same microscopic image. Alternate light, dark bands are there. These are known as lines of Zahan. These are known as lines of Zahan. Okay, lines of Zahan. So these are present in arterial one, not the venous one. The last thing, what is the fate of the thrombus? Bhai, kya hoga finally? Thrombus ban to gaya. The thrombus is there in the artery or the vein. What will happen in the future? There are 4 possibilities. Number 1, the best one, with time it will resolve. It will regress, it will resolve and it will disappear. So that is the best fate we can expect. Okay, so in some cases, automatically with time it will dissolve and it will resolve. I mean, it will disappear. I mean, it will reduce in size and it will disappear. But sometimes it fixed in the size. Neither it is increasing nor it is decreasing. It is fixed in the size. It is known as organized. It is calcified and organized. Neither it increased nor it decreased. Or worse, it can propagate. It is increasing constantly. So either it decrease in size or fix in size or increase in size, or it will detach from its site. Someone was asking, now detachment of the thrombus leads to embolism. I will show you. So till the point it is attached, it is thrombus. The point it detached from the blood vessel, it is known as embolism. So there are 4 fates. Either it will decrease in size with time. So very good, it's known as resolution. Or it is fixed in the size, neither increasing nor decreasing. It is known as organization. Or with time it will increase in size, that is known as propagation. Or it will detach from its side and move freely in the blood, that is known as embolism. How many of you got it? We are done with thrombosis, people. So can we revise it quickly? Now if it is coming for a long question, are you prepared for 3, 4, 5 pages to write it on? Yes, you can easily write these many pages. And if it is coming for short question, write that portion only. If they are asking pathophysiology, write only that. If they are asking the types, differences, write that only. Got it? So I guess we are done. Hannah, the most important thing is the differences between arterial and venous. So here the blood flow is active. Here the blood flow is sluggish. Okay. Here most common site is coronary, cerebral and femoral artery. Most common site is leg veins. Okay. Propagation. This one grow in opposite direction. Retrograde propagation. This one grow in same direction. That is antegrade propagation. Lines of Zahan. Here lines of Zahan are present. Here they are absent. Microscopically, these are pale in color because having more platelet. These are red in color because they have more RBCs. Occlusion. Here the occlusion is partial, known as mural. Here the occlusion is complete, known as occlusive. Complications or effects, whatever you say. So here complications or effects, they will lead to ischemia and they will lead to edema. No need to learn. What you have to learn for your exam, if you're preparing for second prop, learn these headings. Don't learn the differences, you can understand it. You can understand. Learn these headings you have to write and under which you have to differentiate. ओके तो लर्न जो करना है वो पता होना चाहिए भाई लर्न क्या करना है हमें है ना सो तुम्हें अप्रोच नहीं पता होती मोस्ट ऑफ द टाइम एंड ड्रॉ दिस डायग्राम द ब्यूटीफुल डायग्राम नाउ हैव अ लुक ऑन एनी क्वेश्चन व्हिच आर ऑलरेडी आस्क्ड इन प्रीवियस ईयर यूनिवर्सिटी एग्जाम थ्रू आउट द इंडिया वी हैव कंपाइल्ड द क्वेश्चंस फॉर यू फ्रॉम दिस टॉपिक हैव अ लुक ऑन एनी ऑफ द लॉन्ग क्वेश्चन एनी ऑफ द शॉर्ट क्वेश्चन एनी ऑफ द वेरी शॉर्ट क्वेश्चन you can answer each and every thing in that and you are confident that whatever question coming in your exam you are prepared for that. Can I come on the next topic? Next and the last topic I want to teach you, the third topic today is embolus. embolism. Can I start? Before that, let me tell you something. To become successful, you don't have to be brilliant. You don't have to be much intelligent. You have to be one thing. You have to be consistent. Consistency is the key. Consistency is what transforms an average also into an excellence. So you have to be disciplined. You have to be consistent. Your study graph should not be like this. If you take your study graph, so it should not be like this, that you are studying average. One day you are studying for 18 hours and for the next many days you are studying 0. Then again you got guilt, you got regret. Then again you are studying for 15-18 hours. You are burst up for 2-3 days and again you are coming to the baseline and 0. No, this is not consistency. Rather, the graph should be like this. It should be more or less on an average. Okay, so that is the consistency. Okay, it should be average. It is not very high, it is not very low, it should be average. So daily 8 to 12 hours is the average good decent time you should provide to your studies. Okay, so that is the meaning of the consistency. Anyways, let's move to the third and the last topic. We have studied shock, we have studied thrombosis. I'm coming on the embolism, the third and the last topic for today. The rest of the topic we will cover in the next class. Okay, the next class will be on the app. Okay, it will not be on the YouTube. So if you want to continue with the other classes also, you can join on the app. Okay, so on the app only, DBMCI live app, we are going to continue. The remaining all the classes of entire pathology, it will be 80 to 100 hours total batch. So every day we will take maximum 2-hour session. In a month we will be having 5 or 6 sessions, maybe 1 or 2 sessions in a week. We will divide it at a good frequency so that before September or October your syllabus is entirely completed and you can revise it very easily. So that is the plan of action of all 3 subjects we are doing. So of the second prof of patho, pharma, micro. Okay, and the respective faculties will teach you in the much better way. Can we go ahead? Okay, so let's move to the third and the last topic, embolism. Can we start embolism? Let's start it. So what is embolism? Have a look on the university exam questions, the long question, the short question, very short question from this topic. I'm not holding it here, but I can provide you the notes if you wish. These notes will be provided to you on the app only. You can see these notes. So you can have a look on the questions later on after the session, and I'm damn sure that you can answer any of them after attending the session. Let's come on embolism. Now, if you're getting a long question on embolism, under what headings you have to describe it? First of all, tell me the definition of embolism. Bhai, what is embolism? Hota kya hai? What do you mean by that? After that, tell me the classification. I will tell you 4 classification. First classification based on the matter, what the embolism is made up of. The second classification based whether it is infected or not. The third classification, what is the source of embolism. And finally, depending on the flow of the blood. The 4 type of classification I will tell you. Then I will tell you the effects of arterial embolus, the effect of the venous thrombus and venous embolus. And finally, we will see some important embolus which are asked as a short or very short note in your exam. Thromboembolus, fat embolus, amniotic fluid embolus, gas embolus. We will see short note on each of them. Okay, let's start it. In the end, we will revise it. Okay, so what is embolus? As I told you, you can see this is thrombus. This is normal blood vessel. See the normal blood vessel. Inside the normal blood vessel, there is no injury. You can't see any injury. Even without injury, a clot is formed. So I will not call it a clot. I will call it a thrombus. Till the point thrombus is attached, it is thrombus. The point where it is detached, can you see here it is detaching and start freely flowing in the blood. It is known as embolism. Someone was asking the difference. So this is embolism. Thrombus converted into embolism. This embolism is known as thromboembolism because it is formed from thrombus. Got it? So what is the definition of embolus? Embolus is anything. It is not always formed from thrombus. Most commonly, it is formed from thrombus. The thrombus get detached and it convert into embolism most commonly, but it can form without thrombus also. I will tell you the ways. Okay, so basically embolism can be solid, liquid or gaseous mass which is freely flowing in the blood. Okay, so this is a blood vessel of human. Inside the blood vessel, we are supposed we should have RBC, WBC, platelet and plasma. That's it. But apart from that, if any mass, you say, what is this mass? It can be a solid mass like thrombus. Okay, it can be a thrombus. It can be a liquid mass like the amniotic fluid, a clutter of the amniotic fluid, or it can be gaseous mass. It can be an air bubble. Okay, gaseous mass. So any solid, liquid or gaseous mass freely flowing in the blood is known as embolism. So this is the definition of embolism. You should never forget what is embolism. See ma'am, it can be solid, liquid or gaseous mass freely flowing in the lumen of the blood. You can see this is thrombus. It got detached. It is embolus. Till the point it is attached, I will call it thrombus. The point it detached and start freely flowing, I will call it embolism. Got it? So that is the definition. So after the definition, I am coming on the classification. There are 4 types of classification of the embolism. What are the 4 types of classification of the embolism? So first is depending on the matter. Second, whether it is infected or not. Third, on the source. And fourth, on the flow of the blood. Based on the matter, it is of 3 types. Is it solid? Is it liquid? Or is it gas? So we have three physical states now. Solid, I told you the example, thromboembolism. Liquid, I told you the example, amniotic fluid. It can be amniotic fluid, it can be fat embolism. And gaseous, it can be air. So solid, liquid, gas. You have seen the examples. Second classification, this is a blood vessel. And this is a embolism inside the blood vessel. Now there are two possibilities. Either it is infected, the bacteria are present on its surface, or it is non-infected. So the infected one is known as septic embolus, and the non-infected one is known as bland embolus. So they can be septic, they can be bland, depending on their surface bacteria are present or not. Both of them are freely moving masses in the blood, solid, liquid, or gas. So that is the second classification. The third classification, based on the source, whether they are present in the artery or they are present in the vein. Both of them are freely moving. They are not thrombus, they are embolus. Please understand. If I say thrombus, I have to connect it with the wall. I'm not connecting it. Both of them are free. Here also you can see this is free, this is free. But whether it is an artery or vein, so it is arterial or venous, the third classification. Okay. And the fourth and the last classification, depending on the flow of the blood. Now this is arterial thrombus and this is venous thrombus. Now if any of them is present, imagine only arterial is there, not venous. Or imagine vice versa, venous is present but not the arterial. Can arterial thrombus convert into venous? Or can venous thrombus convert into artery? Can anyone answer? Ankshita, anyone, Jayashri, anyone can answer? My question, please understand. Can arterial thrombus convert into venous? Or can venous thrombus convert into arterial? If yes, how? They cannot pass from the organ. No, organ have capillary. They cannot pass from the capillary. So how does they will convert? Means they have to flow from the artery into the vein. How they will flow? Here there are capillaries. They cannot pass from the capillaries. Capillaries are very thin. They cannot pass through them. How? How? Can we convert an arterial thrombus into vein? Or can we convert a venous thrombus into arterial one? How? Yes, we can do so. And that is known as paradoxical embolus. So it is through foramen of ovale. You know, sometimes in the heart, in the interarterial septum, there is an opening that is known as foramen of ovale. Normally it is closed in the embryonic life only, and as soon as after the birth is there. Okay, so it is closed in the embryonic life. But if it remains open, it is a defect that is known as foramen of ovale. So from this, the right side embolus can move to the left side, or vice versa, the left can move to the right. So arterial can move to the venous side, or venous can move to the arterial side. Say yes. So this is the only way the arterial can be converted into venous, or venous can be converted into arterials, and this is known as paradoxical embolus. How many of you got it? This is known as paradoxical embolus. Okay, now listen. This is the blood vessel. This is the arrow showing the flow of the blood vessel. And this is the embolus inside the blood vessel. Where does the embolus will flow? So obviously embolus will flow in the direction of the flow of the blood. This is normal embolus, but rarely embolus flow in opposite direction to that of flow of the blood. Such an embolus, it's very rare. It's known as retrograde embolus. Such an embolus is known as retrograde embolus. So please learn the various classification. I told you 4 type of classification of embolus. The first classification depends on physical matter. And based on the physical matter, it is of 3 types: solid, liquid, gas. Okay, it's very easy. Second, I told you whether it is infected or not infected, infection present or absent. I mean, based on this, it is of 2 types: septic and bland. In septic, the infection is present. In bland, infection is absent. The third one, I told you based on its location, where it is present. So again, it is of 2 types. It can be present in the artery, arterial embolus. It can be present in the vein, the venous embolus. And finally, I told you the classification based on the flow of the blood. So arterial one can be converted into venous, and venous into arterial through patent foramen of ovale, and it is known as paradoxical embolus, such an embolus. And usually embolus flow in the flow of the blood, but sometimes rarely it flows opposite to the flow of the blood, and that is known as retrograde embolus. Retrograde embolus. Okay, so that is the thing. So learn the classification. That's enough. Okay, we don't want to go in detail here. Just we want to learn the classification. So we have seen the definition and we have seen the classification till now. Now I'm telling you the effects of arterial and venous thrombus. So you tell me, use your common sense, you tell me, who will tell me? If there is a embolus in the artery, what will be the effect on the organ? You say, ma'am, what does artery do? Artery supply pure blood to the organ, and there is an obstruction in the pure blood. So obviously the organ will have ischemia. So organ will have ischemia and infarction, depending what is the organ. You say, ma'am, if this organ is heart, I will say MI. Heart is receiving less blood, it will have MI. If this organ is brain, I will say stroke. Okay, so if this organ is foot, I will say gangrene. If it is limbs, I will say gangrene. So depending on the organ, ischemia and infarction can vary. But ultimately, it's ischemia or infarction. Whether you say stroke, whether you say MI, whether you say gangrene, necrosis, coagulated necrosis, it's all ischemia and infarction. So whenever there is an obstruction in the artery, there is ischemia and infarction. Okay, ischemia and infarction. Got it? Huh? But whenever there is an embolus in the vein, who will tell me? What will be the effect? Who will tell me? Let's see. Let's see. Nobody will be able to tell me. It's difficult. What is the effect of venous thrombus? The effect of arterial thrombus, everyone know it's ischemia and infarction. But what is the effect of venous thrombus? What it will lead to? Organ. It will not lead to edema. It will not lead to edema. Let me clarify. If it was a thrombus, if I say the venous thrombus is there, it was through and through obstructing and it was attached here. So the impure blood cannot leave and it will lead to edema of organ. But here it is not thrombus. Please mind it. This is embolus. Embolus is freely moving. So here blood is not halting. Blood is not holding inside the organ. So there is no edema. So what is the effect of venous thrombus? Who will tell me? No, not edema. That is the biggest mistake students do. But don't worry. Do the mistakes here, not in the exam. Okay, if you are doing the mistakes here, it's very okay. Okay, it's good rather. You will learn it. Okay, so venous thrombus leads to edema, I must say, Ankshita. But venous embolus do not lead to edema. Arterial as well as venous, arterial embolus as well as arterial thrombus leads to ischemia. That is common for thrombus also, embolism also. But venous mein aisa nahi hai. The venous thrombus leads to edema, but venous embolus do not lead to edema. So what does it lead to? What does it lead to? Let me tell you. Can you see this diagram? I guess everyone can understand it. See the right side, left side, see all the circulation. Okay, where is the vein? Where are the organs? These are the organs. These are all the organs of the body. Now, just suppose there is a embolus present in any vein. I'm talking about venous now. So here is the vein. It is present in any vein of any organ. This organ can be liver, can be spleen, can be kidney, can be heart, can be brain, can be intestine, can be anything. So it is present in the vein of an organ. So where it is freely moving now, where does all vein go? All the vein of entire human body go in SVC, IVC, superior or inferior vena cava. So ultimately embolus will also move to SVC, IVC. Okay, all the venous embolus will move to SVC or IVC. SVC, IVC open in right auricle. So the embolus will also go in the right auricle. Right auricle go in right auricle go in the right ventricle. So embolus will also move in the right ventricle. From the right ventricle, blood will go to the pulmonary artery. Embolus will also go in the pulmonary artery, and finally in the pulmonary capillary it will cause the obstruction and it will lead to pulmonary embolism or pulmonary edema. So all venous embolus leads to pulmonary embolism. How many of you got it? Now whether it is a vein of liver, vein of heart, vein of brain, vein of spleen, vein of intestine, vein of GIT, vein of gonads, doesn't matter. Ultimately, if vein of any organ of the body, it is going to lead pulmonary embolism. Give me a thumbs up on this. Okay, so what we have learned, the embolus can be there in the artery, the embolus can be there in the vein. Okay, there is a particular organ. This organ can be any organ. It can be liver, it can be kidney, it can be spleen, it can be any organ. So if embolus is present in the artery of that organ, it will lead to ischemia of that particular organ. Okay, but if embolus is present in the vein of that organ, nothing will happen to that organ. So ultimately the venous embolus will affect the lungs and it will cause pulmonary embolism. So venous embolus, all the venous embolus leads to pulmonary embolism. All the arterial one leads to ischemia and infarction of that organ. Venous will not affect that organ. Venous will affect only lungs. I hope I'm able to explain you well. Okay, so that is the effect. So same thing is written. What is the effect of arterial? Tell me. And what is the effect of venous? Tell me. What is the effect of arterial? It is ischemia, gangrene, infarction, sometimes sudden death due to stroke. So that particular organ is involved. But in venous one, all the veins open in SVC, IVC. So the embolus will go in SVC, IVC. From SVC, IVC, it will go to right auricle. From right auricle, it will go to right ventricle. From right ventricle, it will go to pulmonary artery. From pulmonary artery, it will go in the pulmonary embolism. The same thing you can see in the diagram also. Here also you can see this is a vein. This is the embolus present in the vein. So this is coming in the right side of the heart, and via right side of the heart, it is moving to the lung, causing pulmonary embolism. I will show you a video. Please concentrate. So on the next page, a video will come. Okay, can you see? I hope you can see. See it again. See it again. You want to see it again? See, this is the vein. Any vein. So this is SVC, IVC. Okay. So embolus is coming from SVC, IVC. It is moving to right auricle. Concentrate. It is going to the right auricle, then right ventricle, and from pulmonary artery to lung. See everything. Right auricle, right ventricle, pulmonary artery, and then lung. And it is producing obstruction in the lung. That is pulmonary embolism. This is how venous embolism leads to pulmonary embolism. Most commonly, venous embolism formed in the leg veins from the venous leg vein thrombus. Leg vein thrombus dissociate. It will detach. It will convert into leg vein embolus. So leg vein embolus will lead to pulmonary embolism. I hope you got it. So that is all about the embolism. Now we will discuss few important embolism and pack it. So I'm discussing 4 important embolism. Thromboembolism. It is a type of solid embolism. It is formed from the thrombus. That's why known as thromboembolism. Fat embolism is made up of fat. I will tell you how it is formed. It is a type of liquid embolism. Fat is liquid. Okay. Amniotic fluid embolism. It is also liquid embolism. And gas embolism. It is a gaseous embolism, air embolism. Okay. We'll discuss four. One solid, two liquid, and one gas in detail. Okay. I'm interested in the venous version of them. Now, they all can be there in the artery, they all can be there in the vein. But if they are in the vein, they lead to pulmonary embolism. That is an emergency. Sometimes the people die in pulmonary embolism. So I will discuss the venous form of all these four. I would like to discuss. Okay. So first of all, we start with thromboembolism. I guess everyone can understand. Till the point the thrombus is attached to the wall of the artery, it's known as thrombus. Once it got detached, it is no more thrombus, it is embolism. You can see the same here also. It is attached, it's thrombus, but it's detached and moving. So the embolus which is formed from the thrombus, the detached portion, this is thromboembolism. So that's only important about that. Okay, it can be in the artery. Now, if it is the artery, it will lead to ischemia of that organ. If it is a vein, it will lead to pulmonary embolism. That's it. That is common for all. Okay. Now coming on the second one, fat embolism is made up of fat lobule. Fat globule. From where the fat globules are coming in the blood. In the blood, from where these globules are coming and forming a embolism. It's a liquid embolism. You know, we all have long bones in our body. There are many long bones. So this is a long bone. You all can see. Now, just suppose there is a fracture in the long bone. What will happen? If there is a fracture in the long bone, the fat will be released here. The fat will be released. The long bone have red marrow and the yellow marrow. The yellow marrow is coming out, and that yellow marrow is forming the fat embolism. So fat embolism usually come after traumas, the fractures of the bone. Sometimes it can be non-traumatic also. Okay. Sometimes it can be non-traumatic when the lipids in the blood is more. In the blood, sometimes the lipids are more, you know, LDL, triglyceride, VLDL. If they are more, then also they can form. So there are two causes of fat embolism. Most commonly it is traumatic. So after the fracture of the long bone, the fat is coming in the blood, or non-traumatic whenever the lipid metabolism is impaired. Okay, so that also lead to that. Now the problem is that, imagine you are an orthopedician. Can we imagine a situation? Most of the boys want to be orthopedician, huh? So imagine you are a well-renowned orthopedician, huh? And there is a case of fracture. A young boy, a teenage college boy, 21-year-old boy who was driving on a bike, maybe bullet, and he got, unfortunately, road traffic accident. He was returning home from the college and he got a fracture of the femur, and he is coming to you. With the family, with the parents, okay, and you got the fracture fixed. You got the fracture, the doctor, the orthopedician got the fracture fixed, and after 2 days the patient was admitted in the ICU. After that, it is shifted to the ward. You got the fracture fixed by putting a stent, whatever required. You have done the surgery, you have put a cast, and the fracture is fixed. Now the patient is on rest, and after 2 days at 2 a.m. in night, you suddenly got a call from the hospital. The nurse is saying, the patient you have operated, doctor, 2 days back, 3 days back, the patient suddenly have respiratory distress and the patient is dead. We tried resuscitation, but we cannot save it, unfortunately. And you got shocked why the patient is dead. Now the family will not leave you. In such a situation, what does the family will do? Family will think that it is the fault of the doctor. Doctor has done some mistake, and because of the mistake of the doctor, it was a simple fracture case. Why the person should be dead after 2-3 days after the surgery, after the fracture? Why? What may happen? Now, what does happen? You can correlate. So the person is having the fracture, the boy is having the fracture. Because of the fracture, the yellow marrow may have leaked. The yellow marrow may have leaked, and the yellow marrow may have leaked in the vein, not the artery. Let me draw a vein. This is a vein. Now, inside the vein, the fat embolism is formed. All the veins go to SVC, IVC. So it will go either in SVC or IVC. If we talk about femur, so femur will drain in IVC. So it will go in IVC. From IVC, it will go to right auricle, from there to right ventricle, from there to pulmonary artery, and it will go to lungs. So it requires 2 to 3 days, and the lungs, it is causing major obstruction of the main pulmonary trunk. And the person has sudden pulmonary embolism, respiratory distress, and the person can die before you can do anything. So this can be the situation. This can be the situation. Say yes, what you will do now. So you will order an autopsy. To save yourself, to save your skin, you will order a postmortem, you will order an autopsy, you will request autopsy. Okay. Now, just suppose I'm the doctor who is performing the autopsy on this boy, on this dead body. Okay. So what is my responsibility? I will hear the complete history. What is the case? I will understand. My main responsibility is to take out the lungs out of the dead body. cut the lungs, make a slide of the lungs, and on the slide look for the fat embolism. If I got a fat embolism of the slide, I will make my report. The cause of the death is not any surgical mistake, not any this. The cause of the death is fat embolism. Okay, so this is usually situation we see in the hospital, sometimes unfortunately after the fractures. So fracture of the bone lead to sudden death after 2-3 days. On autopsy, you get the fat embolism inside the lung. On autopsy, we cut the lung and we see. So we take out the lungs and we see that. I hope you got it. Say yes, this is the entire situation. Here the organ is the bone, the long bone, maybe the femur, maybe the humerus, the fractured bone. So from fractured bone, the yellow fat may have leaked. The yellow fat forming a fat embolism in the vein. From the vein, it is going to SVC, IVC, right auricle, right ventricle, pulmonary artery, and finally lung. And pulmonary embolism, it is fat embolism, which is causing pulmonary embolism and the person can suddenly die. So I will make the slide and I will stain the slide for the special stain of the fat. There are 2 special stain of the fat we use. Sudan black. Sudan black gives black color to the fat, and oil red. Oil red gives red color to the fat. So it will be visible. If it is present in the lung, it will be visible. And the last one is the amniotic fluid embolism. What is amniotic fluid embolism? Imagine a lady who is pregnant. So she is having the fetus inside the uterus. The fetus is surrounded by the amniotic fluid in the membranes. You may be knowing that. Okay, so this is amniotic fluid. Now this lady is in labor pain. She is having labor pain. Okay, the gestational period is over and she is having labor pain. At the time of the labor, the uterus contracts very vigorously, very vigorously. So whenever the uterus is contracting very vigorously, the baby is coming out of the vagina, the birth tract of the mother. At that time, the amniotic fluid which is present around the baby, it can be pushed into the uterine vein sometimes. Because at the time of the labor, when the uterus is contracting very vigorously, the uterine vein, I'm not saying artery, the veins get ruptured. And the veins get ruptured and the fluid can enter inside the vein and form the embolism inside the vein, in the uterine vein. So whatever vein it is, ultimately all vein, hai na? So at the time of the labor, amniotic fluid may enter the uterine vein due to the vigorous contraction of the uterus. All the vein ultimately go to SVC, IVC. It will go to right side of the heart. It will go in the pulmonary artery and it will lead to pulmonary embolism. So imagine you are an obstetrician this time. You are an obstetrician, you are a well-known obstetrician and you are conducting a simple delivery, normal delivery at the time of the labor or immediately after labor. There was a pregnant lady and who's dead. She suddenly have respiratory distress and she is dead. Even after trying resuscitation, she is dead. So what is the most common cause here? The most common cause is pulmonary embolism, that is amniotic fluid embolism leading to pulmonary embolism. So that can be the situation. What you will do in such situation? Of course, again, the family will be very troublesome in such cases. Okay, the baby may be all right if the delivery already done, but the mother is dead. So it is maternal mortality, one of the unavoidable cause of maternal mortality death. Okay, one of the important cause of maternal mortality. In such situations also, again, we order autopsy. We order postmortem or autopsy. Suppose I am the doctor, I am the person who is performing autopsy on this dead body, on this dead mother. Okay, so what is my responsibility? Again, I will hear the case, I will understand the case. My responsibility to take the lungs out of this mother, the dead person. And in the lungs, I have to search for the amniotic fluid. So I will cut the lungs, make a slide of it. And in the slide, if I got all these things, if I got the epithelial squamous of the baby, the hairs of the baby, bile from the meconium, the mucus of the baby, these all are the constituents of the amniotic fluid. What does the amniotic fluid actually contain? The amniotic fluid contains the hairs of the baby, the skin squamous of the baby, the bile of the baby, the mucus of the baby, the meconium of the baby. All these are going to the lung of the mother. So inside the mother lung, if you are getting all these things, it is proven that it is amniotic fluid, and this is amniotic fluid embolism actually. Okay, so what is happening here? The organ here, which organ we are talking? We are talking about uterus. This time it's not bone, this is uterus. The uterus is contracting, the lady is pregnant, so uterus is contracting at the time of the labor. The uterine vein got ruptured, so this vein is uterine vein which is coming out of the uterus. So the amniotic fluid present in the pregnant lady, it got pushed. It is forming amniotic fluid embolism. From the uterine vein, it is going to IVC. From IVC, it is going to right auricle, right ventricle, pulmonary artery, and finally lungs. That is pulmonary embolism. That can be the cause here. I'm trying hard to explain you. People say, got it. So that's it. Gas embolism we can take next time. Decompression sickness. Next time we can take. I guess the time is over because if I take, it will take another 15-20 minutes. But I guess the time is over and we got a good overview over the embolism. So if embolism is coming in your exam, you have to write down the definition. It can be solid, liquid or gaseous mass freely flowing in the blood. You have to write down 4 classification. The first classification based on the matter, solid, liquid, gas. Second, based on the infection, it can be septic or blunt. Third, depending on the location, it can be arterial or venous. And depending on the flow, it can be paradoxical or it can be retrograde. I have explained you. And then we have seen the effects of arterial embolism is ischemia and infarction. Effect of venous embolism is pulmonary embolism. That's it. Okay, now specific embolism, we have discussed the venous version of all of them. I hope the session was good. You liked it. Have a look on the long question, short question, everything of that. We have covered these three topics. Now, all the other topics I'm going to cover in my next session, which will be there on DBMCI live app. Okay, not on YouTube. So if you want to continue with entire pathology, pharmacology, and microbiology of all three subjects, I will be dealing only with pathology. The other two subjects will be dealt by other two faculties. So all three subjects for the second Prof University exam, specifically for second. This batch is only and exclusive for second Prof. So we invite only second Prof students, because we are not teaching you how to solve MCQs here. We are teaching you how to write your long question or short question or very short question in your exam. And we will give you the tips for answer writing and the practicals and everything. So this is the fundamental batch for the second Prof students. So you can join us on DBMCI live, and we are going to cover entire schedule in the next 3-4 months. We will finish it. So each subject we will take for 80 to 100 hours, and we will take all the topics in detail, and we can claim 100% strike rate in your exam from this only. Thank you so much. Thank you so much for being with me and giving your precious time to me. I hope you have learned the session. So whether you join or didn't join, but this session will be definitely beneficial for you. So don't forget to share the link with all second Prof students, whosoever in your contact throughout the country. Okay, so whosoever is in second Prof and want to understand pathology conceptual or all three subjects in a conceptual manner and want to excel getting a distinction and gold medal in their university exam, they should go for that. Thank you so much. Bye-bye. Good night. I must end this session. Thank you. Bye-bye. Good night. I'm ending it.